Before we begin, I'll go over the emergency response plan for this room. In an emergency, everyone must evacuate through the nearest safe exit. Those seated in the gallery take direction from security, and council takes direction from myself. After evacuating the room, please proceed to a stairwell, take the stairs to ground level, and evacuate the building through the doors marked emergency exit, and go to the muster point. Do not take an elevator or walk through the city room. Anyone with limited mobility should identify themselves to security or myself during an evacuation. And please speak with security or myself if you require first aid. Thank you.
Thank you. Appreciate that. I'd like to call this meeting to order, and at this time I'd like to acknowledge that we meet on the traditional land of Treaty 6 territory in the Métis homeland, and acknowledge the diverse Indigenous peoples whose ancestors' footsteps have marked this territory for centuries, such as the Cree, Dene, Saulteaux, Blackfoot, Nakota Sioux, as well as Métis and Inuit, and now settlers from around the world. I'll begin with a roll call of committee members. Councillor Salvador,
Good morning.
Councillor Hamilton, Councillor Hamilton, Councillor Stevenson.
Good morning.
Morning. I know Councillor Hamilton will be joining us right away. And then we are also joined in chambers by Councillor Tang.
Good morning.
And I'm just looking online to see if I see Councillor Rice,
Good morning.
Councillor Wright,
Good morning.
and I see Councillor Cartmel.
Good morning.
And Councillor Hamilton can call. I see you're online. Just double checking if you're having any audio issues. Okay, we'll come back. Okay, Councillor Salvador, can I go to you for 1.3?
I'm here. Sorry.
That's okay.
The volume was too low.
Yeah,
My apologies.
I thought you might be having a bit of technical audio issues. Thanks, Councillor Hamilton. Councillor Salvador, can I go to you for item 1.3, the adoption of the agenda?
Yeah, absolutely. I'll move that the March 3rd, 2025 Community and Public Services Committee meeting agenda be adopted.
Please vote.
Yes, Madam Clerk.
Thank you, Councillor Hamilton. We have all the votes.
And that is carried. And I will move approval of the minutes from the February 10th, 2025 Community and Public Services Committee. Please vote. Or sorry, are there any errors or omissions? See none, please vote.
Yes, Madam Clerk.
Thank you, Councillor Hamilton. We have all the votes.
Please display the votes. And that is carried. And we have no protocol items for today. We will go to selecting items for debate. As we have speakers on the one item, and we only have one item on the agenda, I'll select that. Or Councillor Stevenson, were you on? So just procedurally, I thought I didn't look up. And then there is one report 5.1. No one wants to select that. We can vote for that.
So moved.
So moved. Councillor Stevenson moves adopting any of the recommendations in any other reports not selected. Please vote. So that would be 5.1, Urath House.
Yes, Madam Clerk.
Thank you, Councillor Hamilton. We have all the votes.
Please display the votes. And that is carried. So that will be rescheduled for March 31st. It'll be coming to committee, correct, Clerk? So, yeah.
That's correct, Councillor Rutherford. Committee has approved the recommendation in the following item without debate. Item 5.1, Urath House Revenue Generating Opportunities with a revised due date of March 31st, 2025.
Perfect, thank you. So we have no unfinished business, so we will move right into our public reports, and we do have speakers on this item. So I would like to move that we hear from the following speakers on item 7.1. Pauline Small with NET in person. Hi. And Irvin Waller remote. Is there anybody else, Madam Clerk, registered to speak?
No, Councillor Rutherford, those are the two speakers we have.
Okay, okay, just hold on 1 second. Okay, so there's one other person. Can you just say your name and then I can get it into record for us to vote? Yeah, we're from I need a name. My name's Kaylee Blewett with UCAN Youth Services. So can we add Kaylee Blewett with UCAN Youth Services to this motion, please, Madam Clerk?
Yes, thank you.
Okay, great. And so can we please vote to hear from those three speakers?
So moved?
It's okay. It's Monday morning.
Yes, Madam Clerk.
Thank you, Councillor Hamilton. We have all the votes.
Please display the votes, and that is carried. And then I'm just going to quickly read a bit of a speaker speech just to give you a sense of what goes on today if this is your first time coming to committee. So whenever we have an item, what we do is administration will begin with opening remarks and a presentation. And then members of the public who have registered to speak will be invited to make their presentations. Speakers will be heard in panels. In this case, there's 3, so all 3 of you, 5 minutes duration at a time. The lights on the podium, if you're in person, will be green for your first 4 minutes. Turn yellow when you have 1 minute remaining, and turn red when your time is up. If you are joining virtually, you may want to keep track of time on your own. When everyone in the panel has presented, members of council may ask you questions of you or your panel members. For this reason, you may wish to remain in the meeting until all questions have been asked of your panel. If you're participating virtually, please remember to mute your microphone when you're not speaking and refrain from using the raised hand function as it creates issues of fairness and decorum. If you're experiencing any technical difficulties, please reach out to the office of the city clerk using the contact information provided in your confirmation of registration at city.clerk@edmonton.ca. If you're here in person with us, which we have 2 of our presenters are, the clerk will guide you to your seat when it's your turn to speak. In the event of emergency, as was mentioned at the beginning, please follow the clerk's direction to evacuate, and city staff will direct you to a muster point. Thank you. And with that, I see we have our administration ready to present on item 7.1, and you have a bit of a delegation. I don't know if you want to introduce your delegation first, Ms. Flaman?
Yeah, certainly. With our presentation, my name is Jennifer Flaman. I'm the deputy city manager for community services. With me today, I've got Stacey Galatly, the branch manager for social development online, Chelsea Harlock, director of Safe and Healthy Communities, Lisa Kardosh, director of community initiatives from Reach Edmonton Council for Safe Communities, and Warren Dreichel, deputy chief, Community Safety and Wellbeing Bureau with the Edmonton Police Service. If we could have our deck up, that would be great. On the first slide still. Thank you for the opportunity to present this For Information report on Edmonton's Blueprint for Violence Prevention, our strategic coordinated approach to reducing and preventing violence in our city. Our partners are here today to speak to their involvement in this work, and we are happy to take questions at the end of the presentation, but we kindly ask that you keep your inquiries of our partners focused on their specific areas of expertise as it relates to this specific plan. The development of an action plan for violence prevention was requested via motion from City Council on September 12, 2023. The motion directed administration to develop an action plan in collaboration with partners as part of the broader community safety and well-being strategy, highlighting key priorities, including but not limited to youth and neighborhood prevention. Over the past year, we've worked closely with partners across sectors, including health, education, policing, social services, and community organizations to develop this blueprint. This blueprint is the first step in the journey ahead to work towards a whole-of-society approach to violence prevention for Edmonton. I'll now pass it over to Stacy to walk you through the details of the blueprint.
Thank you, Jennifer. We want to ground today's conversation in how the blueprint for violence prevention fits into the city's broader strategy for community safety and well-being. Over the years, Edmonton's had significant and strategic investments to address the root causes of violence, from housing and social supports to emergency response and community-led initiatives. This work is guided by the Community Safety and Wellbeing Strategy, which provides long-term, system-wide approach to making Edmonton safer and more inclusive. The Blueprint for Violence Prevention builds on that foundation. It's an evidence-driven, action-oriented framework that identifies local needs and priority investments under the crime prevention and crisis intervention pillar of CSWB. This ensures a coordinated, targeted approach to violence prevention, aligning corporate and community efforts for maximum impact. Strengthening crime prevention and crisis intervention doesn't just reduce violence, it also improves outcomes across all of the CSWB pillars, while advancing key priorities outlined in the city plan and Connect Edmonton. To provide further context on how we're defining violence, I will now pass it over to Lisa Kardosh from Reach Edmonton.
Violence is a complex issue that can mean different things to different people. To ensure clarity, we're using the World Health Organization's definition of violence, which states, violence is the intentional use of physical, emotional, psychological, or sexual force or power, whether threatened or actual, against oneself, another person, or a group with a high likelihood of causing injury, death, psychological harm, or deprivation. This definition is important because it acknowledges the full spectrum of violence beyond just physical acts, to include emotional, systemic, and psychological harm. It also recognizes that violence is not just an individual issue, but one that affects entire communities. Historically, violence prevention efforts have often focused on specific types of violence in isolation. But research tells us that violence is interconnected. Issues that affect safety in Edmonton touch multiple sectors and systems. I'll now pass it to Chelsea Horlock.
Yeah, good morning. It's not Chelsea, it's Warren.
Oh, sorry.
That's okay. Edmonton is consistently ranked 4th for Violent Crime Severity Index across 10 Canadian municipalities of similar size between the years of 2019 to 2023. Edmonton comes in behind Winnipeg, Saskatoon, and Regina. Violence has real and lasting impacts on individuals, families, and communities. It affects public safety, healthcare, emergency services, and how people feel in their own neighborhoods. We also see direct correlations in areas that see high incidence of disorder and open-air drug use with violence.
But reported crime is only part of the picture. We need to consider data sources from other sectors, such as health, in order to better understand violence and its impact in Edmonton. Last year alone, over 4,600 emergency department visits in Edmonton were due to violence-related injuries, putting pressure on our healthcare system and first responders. Violence doesn't affect everyone equally. Some communities and groups are far more exposed to social and physical risk factors that give rise to violence and other health inequities, including youth, women, Indigenous communities, and people of color. Certain neighborhoods also experience more violence than others, often due to social and economic conditions. I will now pass it back to Stacy.
Thank you, Chelsea. The public health approach is an interdisciplinary and science-based approach that draws on knowledge from many disciplines and provides a comprehensive way to help people, organizations, and systems understand how to prevent violence. This approach seeks to improve the health and safety for everyone by addressing the underlying risk factors that increase the chance someone will become either a victim or a perpetrator of violence. Violence prevention requires a collaborative effort across multiple jurisdictions, including municipalities, other orders of governments, as well as community-based organizations, to ensure that resources are aligned and that interventions address the problems at multiple levels. While the core principles of the public health approach remain consistent, the specific interventions and strategies will vary depending on one jurisdiction or the next and their context. Municipalities might focus on community-level programs, while provincial initiatives might address broader systemic issues. Utilizing this approach includes 4 key steps. Firstly, identifying and defining the problem, identifying underlying risk and protective factors that can explain why an individual or community experiences different levels of violence, adapting and evaluating interventions that tackle those underlying factors, and then widely implementing what works. This approach to violence prevention has shown great success in many jurisdictions around the world, including Scotland, Philadelphia, Boston, and Green Bay. Next slide, please. Recognizing the prevention of violence requires a whole of society and systems approach. A crucial aspect of this guide is working and convening a systems stewardship table, and that plays a key role in informing our preliminary needs assessment. The system stewardship table brought together different parts of the system, including health, enforcement, the social sector, and administration, to strategically align in violence prevention planning, emphasizing the prevention of violence before it starts, and when it does occur, reducing further harm. The stewardship table was able to advise on ways to optimize and coordinate violence prevention efforts, aligning interests as mutually interdependent systems, and identify data sets and levers available to each partner that could collectively be utilized for a whole of society approach to violence prevention. Each of these sectors has different roles within the violence prevention ecosystem. The system stewardship table has representation from Reach Edmonton, the Edmonton Police Services, Alberta Health Services, with input from other actors in the system provided to the table as needed. I will now pass it back to Chelsea for the next portion.
Thank you. Traditionally, violence prevention is viewed as the responsibility of the police and the justice system. However, we recognize that in order to tackle such a complex issue, a broader, more collaborative approach that leverages the unique capacities of other systems partners, community-based organizations, and municipalities is required. The city plays 5 distinct roles in preventing violence. Through bylaws and policy, the city oversees some public safety services, including the community peace officers and municipal enforcement officers. City Council also establishes the Edmonton Police Commission by appointing members, establishing a policing budget, and providing oversight, an oversight of the Edmonton Police is through the Police Commission. The city also oversees zoning, which helps shape and improve public health, safety, and welfare of residents and the environment, and is responsible for ensuring land is developed in accordance with city bylaw regulations, buildings are constructed to recognize safety standards, and businesses operate with the correct licenses. The city also plays an important role in convening and coordinating multiple different sectors, agencies, and orders of government to work towards a common vision, such as the prevention of violence. Investment. The city has the ability, while limited, to make investments into violence prevention through funding sources such as the Community and Safety and Wellbeing Fund. The city also leverages resources from other orders of government and funders to maximize impact, such as the Building Safer Communities Fund from the Government of Canada and our partnership with the province to deliver funds through the Family and Community Support Services Program, FCSS. Intergovernmental relations. Violence prevention is a shared responsibility across multiple orders of government and other stakeholders, and all orders of government take different actions in these spaces through their various levers. Effective intergovernmental collaboration between all orders of government and other key partners is essential to creating safe and secure communities. Finally, the city plays a distinct role in ensuring localized understanding of need. Edmonton knows what Edmonton needs. The city is best positioned to promote understanding of unique local context, needs, and priorities, and this becomes critical when ensuring targeted investments are made into our communities where needed most. Each of these roles reinforces our ability to lead, align, and advocate for solutions that prevent violence before it happens. Now, I'll turn it over to our partners again to further highlight the roles and levers they hold within the violence prevention ecosystem.
The Edmonton Police Service is committed to building safe, thriving communities through a balanced approach to support and enforcement. Our mission is to be relentless on crime while being a leading partner in community safety. We recognize that no single agency or sector can solve these challenges alone. While enforcement is a core function of policing, we know that enforcement alone will not create communities free from violence. That's why collaboration is central to our approach. We work alongside health providers, social services, municipal leaders, and community organizations, leveraging each partner's unique strengths to create long-term, sustainable safety. Our crime reduction strategy outlines a data-driven approach to reducing violence in Edmonton, and it aligns with the Blueprint for Violence Prevention. Together, these strategies ensure that policing efforts are reinforced by prevention, intervention, and community-driven solutions. By working with partners across all sectors, we are moving beyond reactive enforcement toward a smarter, more comprehensive approach to violence prevention. That is how we build safer communities, not just for today, but for the future. I will now pass it back to Lisa.
Thank you. As a key partner around the system stewardship table, Reach Edmonton plays an essential role in bringing together community, service agencies, and government partners to drive meaningful action in preventing violence. Reach is a backbone coordinating body, ensuring that violence prevention programs and services are aligned, resourced, and effectively delivered. The City of Edmonton created Reach in 2010 to do this work in a nimble and efficient way, and a handful of other cities have since aimed to replicate this approach across the world, most recently in Bristol, England. Our work focuses on building strong partnerships and supporting evidence-based programs that directly contribute to community safety. That dedication to strong partnerships is why my ED Jan Fox couldn't be here today. She's in an important partner meeting with 24/7 crisis diversion, and she sends her regrets to the committee. One example of Reach's work is our RAPID initiative, a multi-agency collaboration that works with youth at risk of violence, gang involvement, and systemic marginalization. By connecting young people with mentorship, education, and employment supports, RAPID has successfully interrupted cycles of violence and prevented alternative pathways to stability. This program is one of Reach's flagship collaborative partnerships and an incredibly success story that has been looked at as a model of excellence across the country. We fully support the Blueprint for Violence Prevention and see it as a critical step toward smarter, more coordinated approach in Edmonton. The BVP provides the structure, investment, and strategy needed to ensure violence prevention efforts are sustained and scaled effectively. We know that leveraging community expertise and multi-sector collaboration works because we've seen it happen with initiatives like RAPID. Together we can build a city where prevention is prioritized, partnerships are strengthened, and everyone is safe.
Next slide, please. On behalf of our colleagues from Alberta Health Services, community violence prevention is both a public health and criminal justice issue. Building successful intersectoral partnerships to address health is critical to reaching health promotion goals. Violence prevention for health-related systems, such as AHS, focuses on primary prevention with policies and programs that universally address the social determinants of health, such as physical and psychological safety and economic and social well-being, promoting health for all persons and recognizing that structural issues such as racism and economic inequality are barriers to full health. Back to you, Stacey.
Thank you. So now we'll talk a little bit about what we've been up to. Over the past 11 months, we conducted a comprehensive preliminary needs assessment to ensure that the development of the Blueprint for Violence Prevention was data-driven, strategic, and community-informed. This assessment was multifaceted and included the following key components. Number one, defining violence. A shared definition of violence was critical to ensuring consistency across all sectors and aligning with global best practices, including the WHO framework. Secondly, a literature review and jurisdictional scan. We analyzed existing literature on violence prevention to identify what works and what gaps exist. A jurisdictional scan of cities that have effectively reduced violence through a public health approach has also informed our approach. Thirdly, focused engagement with key partners. Rather than conducting a broad engagement, we focused on existing collaborative tables and MOU partners to honor previous engagement efforts and prevent engagement fatigue. It has also ensured that the Blueprint leverages the existing knowledge that we have today. Guidance from system leaders, the system stewardship table, which includes EPS, Alberta Health Services, Reach Edmonton, and City Administration, provided expert insights into how to align efforts across sectors. Lastly, data-driven analysis. To ground the work in localized evidence, we analyzed a broad range of multi-source data, including Statistics Canada, census data, and Canadian Multiple Deprivation Index to identify risk factors. There was also proximity measures and crime data from EPS, 24/7 crisis diversion trends, Alberta Health interactive health data, 311 and 211 service request data, and the housing needs assessment from social development. This comprehensive approach ensured that the blueprint is rooted in violence, shaped by best practices, and designed to meet the unique needs of Edmonton. As we move forward, further engagement will take place with communities most impacted by violence and individuals with lived experience. Next slide, please. Over to you, Chelsea.
The preliminary needs assessment highlighted priority areas of focus and painted a picture for what is required locally to prevent and reduce violence. To address the complexity of violence and crime and its origins, a public health approach to prevent violence is needed. This is an approach that has shown demonstrated success in other municipalities we examined. The public health approach emphasizes comprehensive collaboration, accountability, and multi-level responses to tackle the underlying causes of violence by looking at risk and protective factors that influence violence, victimization, and perpetration. While Edmonton has many programs, initiatives, and services led by community-based organizations and service providers that address and prevent violence, there is opportunity to enhance coordination and governance to maximize impact and identify gaps and opportunities that may exist in the current ecosystem. Where possible, investment should be used to scale up what's already proven to be effective locally. Upstream solutions that address root causes of violence are required to promote safe, connected, and vibrant communities. However, near-term violence strategies, interventions, and investments are also required to address violence that's already impacting our communities today. Violence does not affect everyone equally. Certain populations and communities are disproportionately impacted by violence and should be prioritized with near-term violence prevention efforts. Lastly, further engagement and data analysis is required to provide additional clarity on opportunities for enhanced violence prevention, both near-term and upstream. Next slide, please. The findings of the preliminary needs assessment identified priority areas of focus for us moving forward. The blueprint for violence prevention. The blueprint is the City of Edmonton's plan for reducing and preventing violence. It sets out 3 measurable and tangible goals to address crime and violence, as well as their causes, and outlines key opportunities and work underway that will be explored in the next phase of implementation planning to strategically achieve these goals. The blueprint is strategic, setting the guideposts for determining the most impactful levers to optimize investments, partnerships, and resources. It lays the foundation for sustainability through a whole-of-society approach, rallying together multiple sectors around a shared vision. The 3 goals are: 1, build structure for impact and sustainability, ensuring the proper foundation is in place to develop shared strategic direction and alignment to operationalize the public health approach. 2, prevent violence in the near term. Ultimately, we would like to get to a point where violence is prevented and never occurs in the first place, but we know that there is still violence happening in our communities in the here and now. This goal addresses current situations of violence through tailored place-based and people-based strategies such as neighborhood and youth violence initiatives. And 3, move upstream. This goal looks to primary prevention to address the risk and protective factors and root causes of violence perpetration and victimization to prevent violence from occurring. Each goal includes clear opportunities to explore as next steps, such as the alignment and identification of complementary initiatives with the EPS crime reduction strategy, and expanding our existing efforts to share data and information across sectors, ensuring a data and evidence-informed approach to violence prevention and intervention efforts. The blueprint sets the necessary foundation and creates a shared vision. However, it is not yet an action plan. While an action plan outlines specific actions and the resources, timelines, and measures of success associated with those actions, the blueprint provides a high-level vision, goals, and opportunities. The associated resources and timeline and measures for those opportunities and others that might be identified as this work continues will be further developed as we continue implementation of the plan. Back to you, Stacey.
So talking about next steps, in the year ahead, we anticipate utilizing the $750,000 invested through the CSWB budget allocation to convene the Violence Reduction Network, building off the system stewardship table already in place, and the existing governance models that focus on the prevention and reduction of violence. We will also be completing a phase 2 needs assessment with expanded data analysis and engagement with priority populations to inform the development of the implementation plan, which will include, firstly, a corporate plan that clarifies further opportunities for administration's role in the violence prevention ecosystem. Secondly, an investment plan to ensure targeted and coordinated investments are secured and put into priority areas of focus based on the data and local needs assessment. Thirdly, an evaluation framework, including both process and outcome evaluation. And lastly, an intergovernmental strategy that will outline how we collaborate with other orders of government to promote the interests of and secure investments for Edmonton through strengthened intergovernmental relations. Simultaneously, we expect the Violence Reduction Network will be well positioned to initiate proof of concept initiatives that are evidence informed and ready to scale, such as the work that's already underway within the second goal of addressing near-term violence through the alignment of the Neighborhood Empowerment Team and EPS's crime reduction strategy. While 2025 will prioritize building up the structure for sustainability and scaling of existing initiatives, 2026 will focus on filling gaps in the ecosystem with strategies that have been identified as missing here in Edmonton through the needs assessment. The Blueprint for Violence Prevention is a first step in an important road ahead. We look forward to continuing this good work with our partners who have already been at the table and continue to establish and strengthen relationships with those who have not yet reached but are critical to the work. Thank you, and we're pleased to answer any questions that you may have.
Thank you for that presentation. We are going to go on to our speakers on this item, so I will now invite Pauline Small to come, and the clerk will guide you to your spot. And then Mr. Irvin Waller, are you online? Can you just confirm you're here? And then Kaylee, you can also come and sit beside the speaker number 1. Great, thank you so much. Okay, so as mentioned, you have 5 minutes, and I'll start whenever you're ready. Pauline, with you. Please go ahead.
Good morning. Hello, I'm Pauline Smale. I'm the CEO of the Family Centre here in Edmonton, and I'm here to provide my support of the goals as outlined in the Blueprint for Violence Prevention. A little bit about the Family Centre. We have been around here in Edmonton for over 80 years. We work in the social sector and have been working with FCSS since the mid-1950s. We work with approximately 20,000 Edmontonians a year focused on healthy families in healthy communities. Today, the Family Centre offers a comprehensive range of services, including individual, family, and group counseling, domestic violence intervention programming, youth mentorship support, community development, safety and well-being programming, parenting education and support, and in-home family support. Our team comprises over 200 professionals, including psychologists, social workers, educators, family therapists, and youth workers. We employ evidence-based practices and are committed to ongoing professional development to ensure we provide the highest quality of care. We are a community-based organization. Every year, we work in hundreds of family homes, over 40 schools, in 10 community locations such as the Edmonton Public Libraries and other agencies, as well as in 7 family resource networks. We pride ourselves on our ability to collaborate with stakeholders and bring our work alongside theirs. The Neighborhood Empowerment Team, NET, is another example of this. We have been in partnership with NET for 25 years. It is one of the longest-standing partnerships we have. It has been a critical part of the solution for community safety and well-being, and we are pleased that it was highlighted as one of the solutions in the Blueprint for Violence Prevention. We are very much in support of the recommendations and the goals as outlined in the blueprint. Building a structure for impact and sustainability, prevent violence in the near term. It was specifically noted that the opportunity to leverage our NET partnership to bridge strategic and operational responses to safety and security concerns and help build trusting relationships between residents and the police. And then move upstream. All the goals capture much of the work we do on a daily basis at the Family Centre. We believe that proper oversight, coordination, collaboration, and evaluation are the keys to developing a sustainable city-wide plan that changes the trajectory for children, youth, and parents. The Family Centre's role in NET is to focus specifically on youth engagement. We hire youth community support liaisons that work alongside the community support liaisons from the City of Edmonton and Edmonton Police Service members. In 2024, we received 646 requests, 39 of those from city councillors. We served over 16,000 Edmontonians, 6,640 youth specifically. We completed 24 safety projects, also known as SARA projects. An example of one of the projects was working alongside key stakeholders, including EPS. It resulted in presentations to those who encounter the misuse of caustic spray. In 2024, NET facilitated this presentation 6 times to rec centers, Edmonton Public Library, and to a faith-based organization. Feedback from attendees was positive, and we hope this contributed to the decrease in the number of caustic spray incidents and the impact of them. NET and the role of the Family Centre's youth liaisons have been part of the current safety and violence prevention ecosystem, contributing to the coordination of responses of local solutions, working with the community. We were also part of the focused engagement process to develop the blueprint. NET has been using PANDA and SARA model as outlined in the blueprint for years as a way of working with the community and other stakeholders to identify and build localized strategies around community safety concerns, including preventing violence. Our partnership is strong and creates an impact. YCSL's focus specifically on youth, which aligns with the blueprint focus on youth and community violence. We are collaborative, coordinated public health response in line with the recommendations outlined in the blueprint.
Thank you. I will go to our next speaker now. Madam Clerk, is Irvin Waller on the call?
He has not yet joined the call. We can reach out to see if he
Sure,
can
we'll
get
go
in
to our
touch.
speaker number 3 and then try one more time.
Thank you.
Okay, so we will go to you, Kaylee Bluet with UCAN Youth Services. Please go ahead, you have 5 minutes.
Good morning, everyone. My name's Kaylee. I work at UCAN Youth Services. We are a local nonprofit that serves Edmonton's young people. I would love to give you guys a quick little rundown of the work that we do, some of the gaps that we've identified, and our eagerness to solve those gaps. As I said, I work at UCAN Youth Services. A bulk of the work that we do is facilitating youth employment in a program that serves adults 18 to 24. The work I'm here to talk about today is the work of our Relentless Youth Outreach Program. So we collaborate with EPS to receive the majority of our referrals directly from them. We work exclusively with youth 12 to 18 who have been identified by EPS as needing additional support as a result of their sustained criminal involvement. So we're not talking a few charges, we're talking substantial involvement by the time that they're 13 or 14 years old. So we work with a number of the EPS youth units. We take referrals from the Y50 unit, the spiking unit, the YDI, the missing, lots of units. So we take a lot of referrals from EPS. Many of these youth have been victims themselves of crime and have found themselves in the victim offender pipeline. Many of these youth suffer as the result of lots of barriers. We've got poverty, we've got mental health, addiction, substance use, unstable housing, so many things. Lots of these youth have really not been given a decent chance to be productive, safe, healthy members of society. In terms of the work that we do, we work alongside youth to bring them to a point where they're able to advocate for themselves, engage in healthy practices, engage in employment, education, engage with healthy practices regarding their substance use to solve and provide stability for them long term. At this point, we've had substantial success. Just regarding last year's stats, I can tell you that in the youth that we work with, we saw a substantial reduction in violent violations. So a 64% reduction in the violence that we were seeing from these youth just the year prior. As well, we see a 51% reduction in property violations. We also see a 40% reduction in breach and warrant violations, which is unnecessary time that these youth are spending in the court system that stops them from being able to engage with us in positive ways. So many of these stats they're great to read. We have some really amazing anecdotal stories as well as the success of our program. But what we do see overall is a huge gap. Many of our youth, we work with them because they're criminally involved. The youth that have not met this sustained level of criminal involvement, they're not making their way to our caseload. We say many no's. Maybe once or twice a week I send a no out to someone hoping to engage their child, a kid they know, a kid at their school, with the support that we provide. We're kind of limited by what we can do just because of where we receive our referrals from. We're hoping to branch out and scale up what we're currently doing to include youth that have not met this sustained criminal threshold. The goal obviously would be to prevent them from ever meeting that threshold by engaging with them in the way that we do. So lots of the work that we do is meeting basic needs, engaging with education and employment, engaging with recreation, teaching kids how to be kids again. Many of these youth have not had a chance to enjoy being a youth in Edmonton. Unfortunately, I found themselves in a position to participate in gang culture, participate in drug use. Like there's really some negative things open to them if they're not engaging with positive supports. So we would love to be able to include more of these youth that have not met this sustained threshold of criminality to save them from even getting to that point. We do work with our youth for substantial periods of time. If a youth meets our threshold year after year, we will continue working with them until they either age out of our caseload or they have found themselves making better choices, more positive engagement with pro-social community supports. So that's our goal. We really, really aim to, as your presentation said, scale up the work that we're currently doing. We have great success with the youth that we currently work with, but we're kind of pigeonholed by their criminal involvement. So our goal is to increase our capacity at UCAN Youth Services to support more youth who are kind of at that intersection, at that limbo period of not yet meeting our threshold, but still needing that robust youth support that they're just not currently getting in Edmonton. I think that might be all I need to say. Thank you very much for your time.
Thank you so much, Kaylee. I really appreciate you being here today. And I understand now that the speaker, Mr. or Dr. Irvin Waller, is joined us on the call. Just confirming. Mr. Waller? Yeah, he's online. I've confirmed he's online.
I believe his audio may not be working.
Hi. Yeah, sorry about that. I'm online now.
Perfect, thank you. And just to confirm, it's Doctor, right?
It is.
Yes, Dr. Irvin Waller. Okay, perfect. Please go ahead with your 5 minutes.
Okay, I'm going to be using slides. So if you could bring up my slides.
Sure. The clerk's got them up for you.
And I'm going to go through them quite fast. So I'm impressed by the blueprint. It's on track to reduce youth and community violence, but I want to see 5 things emphasized in the next phase, in particular, to come up with a plan for a 50% reduction of violent crime within the next 5 years. Next slide. So you don't need to be told, but Edmonton has relatively high rates of violent crime. And if you look over the decade, they've been increasing. And there is a real need to have a smart public health strategy for the city. So the BVP is the first step on that. Next slide. So the 5 things that I think need to be emphasized in this next phase is yes, you've got a small group of social planners working on this, but you need to make sure that the lead person is at a high enough level to be able to get through to city council. And if you have magic, if you can get both the province and the federal government to do something along the same lines. The reason for this is that when you have a strong Office for Violence Reduction, the UK has demonstrated that you can achieve reductions both in violent crime and in injuries going to hospitals. And in the previous administration in the US, you see the same. And I would particularly draw your attention to the success of Boston, where the Office for Violence Prevention has basically enabled that city to reduce the homicide rate in 2024 to a rate below yours in 2023. The second point is that you need to provide support for the group during the violence prevention planning. I was actually very impressed by their skills, but I'm a big fan of the Canadian Centre for Community Safety. I think they can help you do even better. You also have Reach Edmonton, but it is important to help them with the skills to do it. The third point is that everybody in this space needs to get to know more of the things that have been proven to work. Canada is very much behind on this, but the UK is, I think, leading. The Youth Endowment Fund is a very important source to look at. It's spending 350 million over 10 years. And I joke that you can actually get that knowledge by spending $35 on my book, but they are keeping up to date. The fourth point is that you need to focus on outcomes. As I've suggested, a 50% within 5 years. I can understand if City Council decides to have a lower target, but the plan should be for a target like 50% over 5 years. Glasgow achieved that from a homicide rate higher than yours in the 2000s. Boston has overachieved that. So you need to be more ambitious. The fifth point is that you're going to have to persuade people to invest in that violence prevention plan. Yes, some of the funding will come from the city, but it's very clear that you're going to need provincial and federal funding if you're going to get the sort of investment that you need. And the main justification for doing that is that you are going to save something of the order of $1 billion in harm to victims. You're going to slow down increases in police budget, in my view, by at least 100 million a year. And you're going to save hospital and jail and other costs. Those are of interest to the province. So that's my main case, but I'll just take you briefly through some slides if we have time. So the next one, next slide.
I'm sorry, Dr. Waller, we are at your time, but there may be, as mentioned, there may be counselors that will have questions about your additional slides. And then the clerk can pull those up at that time if the counselor has questions.
So I've made the main points. The slides are just more detailed for those points.
Perfect, and the committee has those slides, so we have that information with us. Thank you so much. Okay, so now we will go to questions of the speakers. Please sign up if you have any questions of the speakers. It's not letting, Madam Clerk, it's not letting us sign up. Or not letting me sign up, I should say.
We'll add you to the.
Because I see other people are having no problem. Okay, I will start with Councillor Stevenson.
Yeah, thank you very much. Thanks to all of our speakers for coming in, and to Dr. Waller for joining us as well. I maybe wanted to start with you, Dr. Waller, if I could. So really appreciate you being part of the call and you know, for your positive words about this program. I think it's quite exciting. I just wanted to hone in on some of the questions around governance. So right now, the intention is to have the Violence Prevention Network with 3 working groups. Does that sort of meet, I think, what you've articulated before in terms of a permanent violence and crime reduction board? Is that a governance structure that you think will be effective in achieving those ends from what you've seen in other jurisdictions?
I don't actually recall the 3 groups. I recall an advisory group. I think what is really important is the governance structure within the city. So, and I'm not familiar with exactly how the violence prevention group fits into that. But what you see in other cities is a high-level leader, a high-level responsibility center. If you go back to Glasgow, they had a violence reduction unit that was actually only 2 people, and one was a senior police officer, basically a deputy chief of their police, and the other was a public health specialist, and they were the people who did the planning and guided the implementation. And it took them a year or so to get going. And if you like, to do the blueprint or the final plan. And then within 3 years, they had reduced violence by 50%. What you see across the UK are now the 43 regional police agencies in the UK, and 20 of them have a violence reduction unit inspired by Glasgow. And they have done an external evaluation showing 25% reductions in that. And those actual units differ from place to place, but the Manchester one is one that I would draw your attention to. Your planners are already looking at London.
Great, thank you, sir.
Boston,
I'm just mindful, I'm so sorry, I'm on a clock as well, so I just wanted to also get your thoughts. So I think a tension that I've felt in this work is, you know, looking at things holistically as a public health issue. You know, is there, but I guess sometimes I worry when we're looking holistically, when we're looking at the full spectrum of different forms of violence, do we miss some of the focus for targeted outcomes, I guess, in terms of, you know, seeing those really clear reductions? So what's your advice in terms of balancing, you know, recognizing that there are holistic factors, there's many different ways that violence manifests, versus you know, having focus on, you know, specific interpersonal violence, physical violence, for example?
So I think it's very important to distinguish your short-term objectives from your long-term objectives. My slides are focusing on the short-term objectives, what you can achieve in the next 3 to 5 years. And I have a slide there talking about what you should list as targets. So you clearly...
Oh, I think we've lost.
Sorry. You froze, Dr. Waller. We just pause for time for a sec. Councillor Stevenson's time.
Well, thanks. We can come back as well. I think I'll have another round, so...
Did you want to ask questions to any other panelists?
I think he may be back.
Dr. Waller, are you back?
Yes, I am back. So in order to deal with intimate partner and sexual violence, you need to do surveys. And the Center for Disease Control and Prevention in the US has its own survey, which is fantastic, but they've also done surveys, interestingly, for developing countries that are therefore cheaper. And I think you should be looking at both of those. You should be looking at surveys in your colleges and universities. These are not necessarily expensive, but you need to do a time one and then set at 3 years later or every year up to 3 years to check that you're actually getting reductions.
Okay, well, thank you. Thank you very much. I'll have a few more questions for other speakers. Thank you.
Thank you, Councillor Stevenson. Councillor Salvador?
Yeah, thank you. My questions are also for Dr. Waller, but I also wanted to just give uh, a bit of my time if there's a desire to continue with the slide deck. Dr. Waller, would you be interested in continuing? I know you got cut off a little bit early.
I'm happy to go through the rest of the slide deck. I think I've made the main points on 1A about Glasgow and about what the Brits are doing. If you can move to the next slide. The key thing is, I think, to look at Boston. And the mayor there set a goal of a 20% reduction within 3 years, and she got roughly 80%. I think the key thing, and I would strongly recommend that you do this, was a workshop, I think a 3-day workshop where they brought together some folk like me, and the Canadian Centre for Community Safety has more folk like me, community representatives and leaders from education, social services, public health, and police. And I think you can then get from that some recommendations to the council as to what you need to do and what results you can get. Next slide. This is a traditional slide, and this is really what Glasgow did. You need some sort of diagnosis, which is very much started in the blueprint, and then you need a plan informed by things that have worked, and then you need to worry about implementation and funding, and you need to evaluate outcomes. Next slide. So this is just a list of some of the things that I think should be on your shopping list. Outreach to young males. I'm sorry, I missed the previous speaker, but it sounded like she was talking about this. These are incredibly effective. This is the main way that the Glasgow succeeded. It's the main way the Americans have been succeeding. And there's a recent study out of Chicago showing a thing called Challenge to Change, showing a 50% reduction with strong support from school boards. Things to change social norms. I'm not sure if you have SNAP in Edmonton, but you need to have some SNAP programs. You need to do some stuff to generate jobs in areas where young men, and you need to be looking at trauma therapy, which will also reduce some of the overdose stuff. Next slide. So I mentioned this just gives you some ways of measuring. If you look at point 4, you'll see you also need surveys of community safety. I mentioned the first 3. You can think about the red and the green, but I'm most excited about the first 4. Next. I think it's particularly important that you develop a business case. So if you just read the title here, you need to get adequate and sustained funding. Canada has been very good at short-term projects that often don't get going. You need to make sure that these are permanent and adequately funded, and probably with funding from the feds and the and Alberta. And if you do that, you should be able to get a 50% reduction. I mentioned these numbers: $1 billion reduction in harm to victims, avoiding 100 million in increased police costs. I think you can actually get 200 million without too much difficulty, and then 65 million in jail and health costs. And in order to do that, my rough number is that you need to get 25 million a year. Next slide. So I've covered everything. Thank you for the opportunity to do those.
Great, thank you so much. I will have some questions, but I'm out of time this round, so I'll come back for another. Thank you.
Thank you, Councillor Salvador. Mayor Sohi?
Yeah, I'll just follow up on that, Dr. Waller. Thank you so much for joining us. Under our community safety well-being funding, we did divert some resources from EPS into the community safety, and that amounts to, I think the total amount is about $22 million on an annual basis. Are you saying $25 million accumulated total, or are you looking for 25 million? Are you saying $25 million per year for next 5 years that is built up to $100 million?
I'm saying 25 million a year so 25 million this year, 25 million next year. And this is only for the violence prevention. Yeah. And it's possible that it's more than that, but with something like 25 million, you should certainly be getting reductions. So one of the things the planners have to do is actually look at the numbers of young men you need to reach in outreach, the number of preteens that you need to reach through SNAP and so on, and develop a budget. But I drafted a budget for Edmonton, but I haven't included it in the slides.
Yeah, you're talking about violence in general, right? But your strategy focus on youth.
My focus is on the list in the slide. So it's on homicide and what the Edmonton police would call violent crime, and on what a hospital would call injuries caused by crime, and it would include street, school, and intimate partner violence. I'm not an expert on hate crime.
Okay, got it. Thank you. Maybe to Kaylee, how do you, like a lot of young people use our city facilities, whether they're rec centers, whether libraries, public transit, how do you see city playing a role in diverting some of those troubled young people from, situations that they get into, and how could that be done?
Of course. So we are very well versed in the violence that occurs at rec centers and lots of city buildings. Unfortunately, many of our clients are the ones causing that violence. We anticipate that with additional funding, we would be able to support more youth. So in that, essentially, we would hope that our engagement with, we're a two-pronged program, essentially, so it's one youth worker and one constable assigned to every client. So we've found real good success in this kind of suppression surveillance and then intervention support program. So we have had, I don't know if you heard the reductions, but we have substantial violent reductions when it comes to our relationship with these youth when we're building a positive, healthy engagement with these people.
Yep.
As well, idle hands are the devil's plaything. When your hands are not busy doing something productive and healthy and social, usually there's going to be bad things to be done.
Yeah.
So we definitely see that when our youth are engaging with us very, very well, re-engaging with education, looking at what employment might look like for them, engaging with the supports that they need to live healthy lives, we see a lot less incentive in participating in things like that. So we would like to see more Edmonton youth supported with robust youth support to prevent them from finding these negative groups of people that are willing to do these negative, violent, harmful crimes in community.
So with transit, we have peace officers, police officers, then we have social workers through Bent Arrow Healing Society. Do you get referred young people through that program or through intervention to your organization?
Yes, but we have to say no, unfortunately, because if we don't receive referrals with that sustained criminal threshold, they really don't meet our mandate. So I get referrals on a weekly basis from schools, from probation officers, from community members, from parents desperate for that kind of support, and they're just not getting it because there just isn't really that many programs around in the city to support that level of risk.
So your program is only if somebody gets into trouble, then they get.
Correct.
Oh,
So
okay.
we attempt to do early intervention, but at that point, is it really early intervention if they're already being charged?
Yeah.
So we would love to support more of those youth that are showing the warning signs of this violence and this potential to commit crime, but they haven't quite yet got there. If we could kind of get in and support them into that, the period that they're really bought in and that critical buy-in window, that would be
Got
ideal.
it. Thank you. I'm out of time.
Yep, thank you. I'm going to stick with Kaylee. I definitely hear what you're saying, because when you said that you get referrals on the Y50, I don't know if necessarily my colleagues might know what Y50 is, but it is essentially a list of the 50
Most prolifically criminally involved city
youth.
young youth.
Yeah, and I know that from my work with the Office of the Child and Youth Advocate. So, these are I would say well beyond early intervention.
Yes, I can even speak to another caseload that we take referrals from is the Wi-Fi or the EPS spiking unit. So
Yeah.
this is a unit of people that have not yet met that sustained threshold of criminality, but they're seeing, for example, our 2023 kids to the 2024 youth, 119% increase in violence from the youth that were identified on this spiking caseload. So in a 6-month period, there's a 120% increase in their violence, which leads to, of course, all kinds of things. So
Yeah.
yeah.
No, that's great, and you have really impressive numbers for the reductions too. I'm going to go to Pauline for a second. I was curious more. First of all, I wanted to clarify: did you want to be on register as NET or Family Center? Because I noticed that you're.
Yeah, I'm here with NET today.
Okay.
but
Okay.
I
Perfect.
mean-
Just wanted to double check.
Okay.
Perfect. And then you mentioned that you have a longstanding partnership with NET, and then you do these safety projects, and the Panda projects and the Sarah projects. What kind of outreach have you done in areas where we know there's like maybe youth, as was mentioned by Keely, sort of being idle? Do you have any projects like that, or is that a gap you see?
Well, it is a gap, but we do have projects. I wouldn't be able to go into the detail
That's
of
fair.
the projects, but certainly one of the purposes of the work that we're doing is to engage in community activity. And it's more of a community development model, and therefore we're bringing and leveraging the relationships we have with other community entities. One would be youth. Of course, but bringing players to the table to strategize around certain situations and create plans. Sometimes it's education, sometimes it's awareness, and then we pull out. We're not a long-standing, and we're not working one-on-one with youth in the NET program. It is more community engagement and relationship building, bringing in the players that already exist, leveraging the skill set and identifying the problem. And that's where Sarah and Panda come into play. So both of those models are problem-oriented policeman type models, whereby you're going in, you're doing a scan, you're doing an assessment and analysis, creating a intervention, and then evaluating it.
Okay, perfect. And I wanted to go back to Dr. Waller. One of your slides that Councillor Salvador kind of had you going through had the piece around deterrence but not discrimination, and I just wanted you to elaborate on what you meant by that. I think it's really pertinent, both in our terms of our violence prevention, but a live conversation we had last week around our public spaces bylaw. You're on mute still, or we can't hear you.
So the Americans have, in some cases, had community violence intervention that is pre-arrest, although police may refer just as much as schools or families might refer people to that group. They have also had community violence intervention associated with focused deterrence. So this was actually part of the Glasgow project. So what the police did in Glasgow was they did, and it's the same in US cities, they did a call-in of the people who they thought were most involved in the violence. And there were outreach workers there, and there were their mothers there, and community people. And the idea was that the police were pushing these young men towards the outreach workers. And this is okay, but unfortunately for those people who don't go, you just get them arrested, and this has generally got not good news for the city. Arrests and incarceration are not generally good news for whether those people will later on be involved in crime or not. So I'm actually a big fan of the youth justice program that is actually on the federal ministry's website. And this is based primarily on referrals. The Chicago project that I mentioned is on referrals. So, and then you get away from Black and Indigenous kids being disproportionately targeted.
Thank you. Appreciate that. I'm out of time. I'll go to Councillor Tang.
Great. Thank you very much for all the speakers today. Kaylee, appreciate sharing all the work of UCAN. Certainly have heard about, appreciate, and respect the work that you all do. What are your thoughts on this blueprint of violence prevention?
I must say, I didn't have a ton of time ahead of time to read it, but from what I heard from the presentation, everything sounds like the stuff that we talk about in our office. We talk about this frequently. We are a very, very close collaborator with EPS, so many of these conversations are things that we're passing through just as our team, our outreach team discusses like how we can be doing a better, more effective job with the resources that we have. I feel like there's a lot of players that are wanting to solve this problem. And if there is some effective collaborating being done, of course, but of course we can always be better together. We have a really strong model. I didn't really talk about it, but we're called Relentless. It's funny that it was mentioned to that word. Our relentless approach to youth work is what gets us these results. There needs to be more supports like this. So I would love to see the scale up part was the part that I really appreciated. We are doing the work already. We know how to do it. We're very, very equipped to do it, and we have great success. We just need more ability and more capacity to do so. So I think that scaling up initiatives that are already working, because as you said, establishing new things can take some time before things really start to show.
Yeah.
Especially with this type of population. Like, these people are not looking to engage positive relationships. It's really challenging to build relationship with people who don't want it, but we still manage to do so. So if we can continue with more of these efforts into early intervention to stopping this before it becomes a 17-year-old kid with 150 charges that are violent in nature.
Yeah, exactly.
So I'm very bought into everything you guys are saying.
Yeah, and I think as you were describing, I see them really as a microcosm of really what could be happening and what we need to do that's more at a system level, wider level. That includes not just one organization like yours, but lots of different players. And I really do hope you can continue to engage with this initiative. Pauline, I gather you've been involved in this space for a long time.
Yes, we have, yeah. 25 years with NET.
Yeah, and this is not the first time we've seen sort of a Reach EPS City of Edmonton violence reduction strategy. What do you feel is different this time?
What I think is different is that they're focused on oversight and governance, coordination and collaboration. So building what is already going on in the community, decreasing the gaps, working together. I think it always, I really appreciated Dr. Waller talking about governance. I think you need the right players, and I think we have them in Edmonton. You need leadership at the table. This isn't a front-end sort of project. You need leadership at the table, and you need appropriate governance. The other piece that's critical, and it's written within the blueprint, is evaluation. There's no point in doing any work unless you do the full flow through and you're evaluating the work and adjusting as need be. But I just want to echo that I think that the players in the community exist. I think it is a scaling up exercise, but it is also about governance and coordination.
That's interesting. Yeah, I have lots of questions for administration on the governance piece, but thank you for that. And then Dr. Waller, I think thank you for being here. When I initially crafted the motion that led to this work, it was a lot of influence by your work and what I was seeing in the community. I think the 5 conditions you mentioned, I think I see certainly intent of continuing that work in this blueprint. But this higher office, I gather, like in the Boston case, it's linked to the mayor's office, for example. I guess, how do you see an entity like that versus kind of the violence reduction network mentioned in the report? How do you see an entity like that survive political turnover?
Well, I worked in Alberta in the 2000s, so I'm very scared by what can happen with a change in political view. I think the key is demonstrating success. And so Kaylee, if I got her name right, talked about scaling up, and the previous person talked about scaling up. You have to have enough money to do what is needed so that you actually get a change in the overall violent crime rates for Edmonton. And it's as simple as that. So somebody has to take the jump to get the money. The mayor sounds to realize the importance of smart funding. And if you don't get smart funding, and you need a sort of portfolio, a lot of the discussion has been about some type of youth outreach before they get involved, but you also need programs like SNAP.
Thank you. Thank you. I'm out of time.
Thank you, Councillor Tang. Councillor Wright? And
Thank you very much.
Sorry, just before you start, Councillor Salvador, can you quickly take the chair if I refresh my coffee? Councillor Salvador? I'll hand the chair to Councillor Stevenson, who's in chambers. Can you take the chair for a minute?
You bet.
So please go ahead, Councillor Wright. Sorry about interrupting your time.
Thank you, and enjoy that coffee. I'm just, I guess I have questions for Kaylee with you, Can. I'm just wondering, does this blueprint help the youth that you work with right now? Or would the funding be better used to actually do the outreach that you do?
I'll say yes to both questions. I think that there's a benefit to a greater knowledge and understanding of what youth in Edmonton are currently facing and what the reality of their lives is. Increased knowledge of this, increased understanding of the struggles that these highly criminally involved youth go through, I think is definitely going to help. The public view of youth that involve themselves in these acts is not positive. So I think an understanding is what leads to the slow understanding and the growth in mindset that these youth are just youth who've been placed in this position by an adult or failed by a system or found themselves in a place they don't want to be in, and they're making the best choice out of 5 bad choices. So to answer your question, I think it does help. I do think that the money could be well spent with what we're already doing. We try to access essentially any grant or funding that will support the work we currently do, but there's always more. Like we've had, I'm not sure what's changed in Edmonton, maybe just the changing landscape, the drug landscape, the crime landscape, but we've had a lot more interest in our program over the last 6 to 9 months from community members, from parents who are just terrified that their kid's going to be a kid that you see on the news, right? So we are supremely aware of the fact that there could be more done. There's not a shortage of these youth that need this support. Almost every youth could benefit from a professional, safe, healthy adult in their life to support them with the things that they're wanting to do. But so to answer your question, yes, I think it is effective. The blueprint will help, but I think we could also benefit from additional funding for this specific population of people.
Okay, and you mentioned that you don't know what's changed in Edmonton, but isn't it across the province, across the country?
Absolutely. Specifically for us, it's just that we've got more interest. We don't really advertise for our program, which tells you that there's people seeking it out, Googling, trying to find resources to support this high-risk youth. So I would say absolutely the country has seen a shift in what youth are experiencing, but specifically at our little microcosm of Edmonton's youth, from 12 to 18, we've seen such a severe change in the need for really, really supportive people.
Okay, so it's not unique, and yeah, if we can learn, I guess, from other jurisdictions, that would be helpful. Thank you. And Dr. Waller, I'm just wondering, you had said that we need to, we need to have the hierarchy in place and a higher level of making sure that we have, I think, the resources at the higher levels of government. So is it the city's responsibility to be the ones to convene and coordinate, or should we be more advocates to those higher levels to have them establish this framework?
Well, I think the reality is that because you have a team working on a violence prevention plan, you are in a really good position to make a compelling case to the city of Edmonton, to the province of Alberta, and to presumably Public Safety Canada for the funding. And this needs to be sustained funding. Kaylee talked about grants. I don't believe in grants. Grants haven't worked. Scaling up means that you actually have to put enough money into programs that Kaylee talked about to get real reductions. And I've mentioned SNAP. I'm not sure if you're familiar with it. Maybe you have SNAPs already in Edmonton, but you have to have enough of the outreach workers. You have to have enough of the SNAP programs. You have to have enough of training for youth that you're actually going to make a difference. So I'm not sure if I'm answering your question, but
yeah, and I've heard that from a lot of organizations that they need that sustained funding, and so yeah, the one-time grants aren't necessarily going to cut it. And I guess my question is whether the city should be taking this on with our limited resources, or whether we should just be again advocating to the province for them to take responsibility of it.
Well, from where I come from, you develop a plan with a compelling case, and you see what you can get within the city, but you're going to need to make the case to the province and to the federal government.
Okay. Thank you. My time is up.
Thank you, Councillor Wright. Sorry, I lost the list. I think it's Councillor Stevenson for second round.
Yeah,
Please go ahead.
Thank you very much. Really appreciate the discussion this morning, and I think have certainly heard from Kaylee around some of the existing gaps, but maybe to both of you here, how quickly can you scale up? If we are able to get some resources flowing, how quickly could we see that happen?
I think it can happen relatively quickly because we're not starting from scratch. We have the players in place. We know what we're looking for. I think the blueprint gives us some guidance, and I don't think you have to create something new. I think that's the whole point of scaling up, is using the network that already exists.
Great. Kaylee?
We could look at within the next few months. Like, we have already the caseload is built. I've just had to say no to them. So same thing. We have the framework. We have the relentless model already in place. It's just being able to have the capacity to accept those referrals that we get every week.
Okay, that's great. And I just want to clarify too, Kaylee, are you able to accommodate all referrals from EPS right now, or are there gaps there as well in terms of?
It's funny you asked that. In a recent meeting with the chain of command with EPS, the question we received was, how do we get more of you? So
Okay.
there is from the high level of EPS, there is the desire to grow from their end as well. It's other units, it's other jurisdictions, other divisions saying, hey, we're having these issues, these youth are at the cause of it. How can we support more? So yes, absolutely. At the current moment, there isn't a huge wait list from EPS. However, they have enough need to grow as well.
Yeah, and there is also the community. Did you want to add something further? No.
Yeah, I was just going to say, I mean, we have a wait list in terms of our projects. We definitely don't have the people on the ground that can do the work. My point is that I think the entities exist that we can build upon.
No, that's really helpful and really encouraging because those solutions are there and we have that opportunity to scale them up. I think just my last question, I really appreciate you both speaking to the importance of governance and that collaboration. But that collaboration does take resources from your organization. So being able to have someone to send to meetings, how do you manage that? And are there resources that you and maybe other similar organizations may need to help you fully participate in this model? Any thoughts?
For us, collaboration is something that we do all the time. I don't think there's any issue as complex as violence can be addressed without collaboration. There's just too many different people that do different pieces of the continuum. What I like about this plan is that it talks about the immediate, building the structure and impact. It also talks about in the near term, but then it talks about moving upstream. And you need different players at the table to be able to do that. Community engagement, what we do, community development, what we do, is going to is more upstream. It's more about engagement in terms of the entire community and the players within there, the people that are providing services. The work that Kaylee is, I'm not speaking for you, but is certainly more in the first tier of what we're talking about. It's that direct trying to focus on the Y50, et cetera, youth. And I think both are necessary.
Yeah.
Sorry, can you ask your question again? I'm sorry.
Yeah, no, and I think absolutely hearing the central importance of that. How do you resource? You both being here this morning, for example, how do you resource someone being able to go to those meetings to collaborate? Is that an area where additional support would help you participate more fully?
Absolutely, yeah. We use volunteers where we can, but obviously having our frontline staff present at those meetings to hear things, be able to share anecdotal stories, collaborate with other agencies that might have a solution we haven't quite come up with is key. We are, we're really pigeonholed by size. Like, we only have 6 youth workers serving Edmonton's top 80 or 85 most criminally prolifically involved.
Wow.
So it's those other youth that we would love to capture that haven't quite made it there, and we could prevent them from even making it there.
Yeah,
So absolutely, we collaborate in the way that we can, but we're spread thin, right? Like, we're an outreach team. We bend to the needs of our clients. If those clients need us more, there's other communities that essentially get neglected as a result.
Yeah, or the collaboration efforts get neglected because you just can't
Exactly,
afford
there's
to
just
send
not enough
someone.
of us.
Okay. Well, thank you very much again to you both for the work you do and for joining us today. Thank you.
Thank you, Councillor Stevenson. Mayor Sohi.
Yeah, thank you. I just want to, carrying on with the questions, Kaylee, thank you so much for your work. I had a good relationship with your former boss, Kyle Dubé, and I'm familiar with the work you're doing somewhat, but it's been kind of disconnected for a bit, right? So there are 3 goals to the blueprint. One is strengthening and connecting the existing governance structures, and second one is prevent violence in the near term. That's where you where you do a lot of work, right, in that area.
I would say so, yeah.
Right, but move upstream. Like, they're interconnected. Like, if we're unable to deal with some of the structural social determinants and root causes, the middle part, prevention violence, is there'll be a cycle. There'll be ongoing demand in that, right? So what I'm hearing from you is that the upstream part, where you can connect with young people before they get into trouble, that's where you're seeing a lot of gaps.
I see gaps there, and I see gaps in there's a population of youth that kind of seems like they haven't really been supported in the way that they need to. Like I said, we get lots of parents, community members, probation officers, school supports reaching out, requesting this type of support that they're just not able to access. So it's the upstream, definitely. It's the governance, it's the understanding, it's even the desire to want to support people like this that cause pain and turmoil and violence. So I see a huge gap in the additional referrals that we have to deny because they haven't met the criminal threshold yet. So they're still being charged, but they're not collecting this high level, so they're not as big of a deal yet. So if we could connect with those youth, we could prevent that from even happening, and then our early intervention would be so much more successful because we're not having to break habits that have been formed by years and years in the justice system as a young person.
Yeah. You heard Dr. Waller. He mentioned about setting a target, and he think it's possible if you if you invest $25 million, you can actually reduce violence by 50%, right? Like, if there were resources available, say if there were $25 million available ongoing, is that achievable? Like in the Edmonton context, because you're more at the ground than Dr. Waller is. I mean, he's familiar with Edmonton as well, but he's not here, right? But you were out in the community doing this work. Is it possible?
I think so. Yeah, I absolutely think so. I think you were right. We have the right players at the table. There's people who are caring about this population and understand the effects to community members are here. I absolutely think so. We have anecdotal success when it comes to youth who are resistant to support, building strong relationships, making it through employment programs, maintaining employment for a full year. Like those kind of things are the things that we are able to speak to and brag about when we have the support and the resources to be able to do so. So
Got it.
our desire is just to support more. Do I think that we could mobilize $25 million? I'm sure there's lots of agencies that would love to have more funding. I definitely think it would make positive change.
Yeah, it might be reallocated. I mean, like the community safety well-being funding is currently allocated, but it's allocated to some of the work that you're doing and others are doing, right? So that definitely there has to be prioritization within that, right? But if there's a focus on, like if the blueprint is approved with those 3 goals, and the next part is resources, and if resources do become, that will be my question to our administration and the delegation as well. Like if there's will to have $25 million allocated, what I'm hearing is that we can make a significant difference in the reducing violence in our city.
I would say so. We're a very small piece of the pie. They're a very, very criminally involved group. So in that group, we see such substantial reductions that I think if we're talking about communities or folks that are not as involved, you'll see even better results because there's not that depth of criminal involvement to try and pull them back from.
Yeah, got it. Thank you. Appreciate it. Thank you.
Thank you, Mayor Sohi. Councillor Tang?
Yeah, just a couple lingering questions. Certainly lots of questions for administration about funding and resourcing as a next step. But I just want to clarify for UCAN, for example, is city historically your largest funder?
No. Our main partner is EPS. Well, I guess technically, yes. We get a lot of funding from Alberta Crime Prevention.
That's provincial?
Yes, and then EPS. So I guess, I think about a fifth of our city.
Yeah, so, I mean, I can, obviously with the link to the justice system, et cetera, and I think my read of the blueprint isn't so much about who gets what and how much. It's really about how do we be strategic with the existing funding that we already have, because we don't have any more, right? Like, how do we be more strategic and really drive those outcomes? And I really love that you've been keeping track of your indicators and outcomes, and I really hope that you're engaged in that next phase around evaluation framework, which again, I also have lots of questions about, but I'll direct that to administration. Just back to Dr. Waller, just to clarify, when you say on your slide number 3, $25 million annually, do you see all that coming from the city, or is that really to the 5th condition around accelerating funding at the federal provincial level as well?
So the mayor said I'm familiar with Edmonton, but I'm not that familiar with Edmonton to know exactly the situation. But my gut feeling is that you will put up the money to get a really good plan and a compelling case. Compelling case is very important, and you will then see what you can fund. I don't know whether EPS would transfer money or not, but so Alberta has a whatever it's called, crime prevention office, and I think you need to make a compelling case to go to them.
Okay.
And I think you also need to make a case going to the federal government. What you need to watch out for with the federal government is that they've been into projects and you need sustained funding.
Yeah.
And they may be able to fund some of the plan and the evaluation, for instance.
Yeah.
But the core funding for scaling up enough, and this is so important, you have to scale up enough that you're actually going to see reductions at the city level. This is why Boston and Glasgow and the British spread is so important. It's not one project that Kaylee's talked about. Kaylee has talked about scaling up and getting to young folk before they become repeat
we need a
offenders.
systems of UCANs, for example. We need a system of family-centered programming, a system of lots of people who are not even in this room who are leading, doing great work. But that I think helps because it seems like you're really talking about sort of that collective effort because it is, you know, at many different levels. And I mean, I do also feel that a lot of the examples you have given comes with very different legislations, you know, governance structures, funding sources. Even just when I was looking at this report's jurisdictional scan is quite different. I was wondering if you can elaborate on your number 3. The Youth Endowment Fund in the UK, is that a government initiative? Is that a community initiative? Is this a funding body, or is that condition 3 really just about really understanding what the problem we're trying to solve is?
I think the neat thing for you is that you can just go on their website. They are the equivalent of 350 million Canadian dollars, so that's 35 million a year, just to look at what works and to promote it. But you can go on their website and see what works.
Okay, thank you.
But I think you have to combine looking at the Youth Endowment Fund with the results of cities that have had a reduction across the city. So that's why Boston is so important, and staying in touch with London, and I like Manchester, and looking at how Chicago has not succeeded because it doesn't have an overall plan.
Okay, thank you very much. That's all my questions, and thank you to all the speakers for making time today.
Thank you, Councillor Tang. So we will go to questions now of administration and the delegation. And again, I just want to remind my colleagues about what Ms. Flaman said at the beginning of her presentation. We do have experts here from AHS, from EPS, from REACH, NET, and let's focus any questions. While there's a lot we can talk about with them, let's focus our questions specifically on the report in front of us today. Is that a good summary, Ms. Flaman? Yeah, thank you. Okay, and I'm actually going to go first. I just have some broad, holistic questions that I'd like to ask. And I guess I'm going to start with one. It was fuzzy to me, who is the backbone support? Is it REACH?
Thanks for your question, Councillor Rutherford. For the Blueprint for Violence Prevention, the city was convening, so we were the backbone convening the system stewardship table. So that was a distinct role that we played on this initiative, as opposed to where REACH is convening around programs and services in the violence prevention space.
Okay, so but in the structure that's proposed in this plan, who is sustaining that structure?
The city would be.
Okay. Interesting. I don't know how I feel about that. Can you elaborate more on why? Because to me, this is exactly why we created REACH in the first place. And as the REACH advisor, was to be this backbone organization, systems, court, like that is supposed to be. And it sounds like they're more deferring to programs and services. And I'm concerned about that.
I think this is a space right now where we're working really closely with our colleagues at REACH and leadership at REACH to define our roles, because there are times that the city convenes, there are times that REACH convenes, but when it comes to setting the overarching strategy for the city, including intergovernmental relations and the intergovernmental strategy that we want to build to support investments, I think this is a space that it does make sense for the city to convene with REACH still around the table, so we can properly coordinate our respective levers in this space, which we spoke a little bit about during our presentation, and I think that's been really key for all of us at the system stewardship table, is really understanding who's doing what, where we both have, or we all sometimes have, really complementary levers. We also have distinct levers, and so I think reach value that they bring to the table around this and looking at where they can convene on different programs and services, where they can support some of the different plans that we have aligned to the blueprint. We have kept it distinct but complementary.
So how much of the 750,000 that's been allocated to this is going to go to the city as this convening role?
As of right now, we don't have a very intricate budget mapped out for the 750K because our plan is to use the needs assessment and quickly be able to move into action, scaling initiatives that
So
we
is
know.
there already admin capacity for the, so that is already in the base budget, is my question?
Yes, so supporting the next phase of the plan, standing up governance, the needs assessment, we are working with our partners at the stewardship table that we don't anticipate a majority of the funding of the 750K would be required to go into that.
So that would be able, so just to confirm again, as you're scaling up, as you're doing the proof of concepts and those pieces, that 750 is earmarked to be out doing violence prevention in community?
That is our hope, yes.
Okay, perfect. How do we ensure we don't get stuck on goal 2? I've seen this before. I've seen this as a downfall in many things, right? It's like, we're gonna start upstream and then we'll move downstream, but then the upstream becomes, you know, we've heard it, like the youth violence increased 191%. So all of a sudden, more upstream, you end up putting more resources into upstream. When I read this strategy, I thought, oh, we have a real risk of getting stuck at goal 2 before we even get to goal 3.
I think this is the importance of goal 1 in building that governance to connect the dots across all of the goals, really. We're working closely with our partners who do primary work upstream. We're working closely with our partners who are focused on that intervention on violence in the near term. As you heard from our speakers here today, many of them are wearing different hats and working different spaces. But I think as we target what is showing up through the needs assessment in goal 2, we're able to also make sure we're putting those strategic investments and supports that are needed into that upstream space in goal 3. And using each to inform the other as we keep going. I think
so
that
as you're
simultaneous
seeing,
approach.
like if you were seeing more upstream, the goal of the stewardship table, if I'm understanding correctly, is to say, okay, well, if we're seeing more, what do we need to be doing upstream to stave this?
Exactly. Those two pieces need to work together very closely.
Okay. And then I'm almost out of time. I have a second line of questioning around assets as opposed to needs assessments, but I'll come back for that. Councillor Stevenson.
Thank you very much. Yeah, I'm really excited by the overall blueprint. I think the 3 goals are excellent and help move us forward now and sustainably into the future. I just want to dig in a little bit for my own understanding around the governance structure. So right now we have the stewardship table. Does that transition into the oversight board? Or does the stewardship table remain sort of independent from those pieces?
The intent with our next phase in building out governance is to leverage the stewardship table as a starting point, but as you'll see articulated in the goal, we talk about building off of existing governance and networks as well, because it will need to be beyond just that stewardship table. So that group will absolutely be part of governance in this next phase, but we're going to work closely with other groups who are involved in this space as well to build out a more comprehensive governance structure.
Okay, because I see the value in that, because I think you're right there. Well, I see a tension, I guess, because I think what we heard from Dr. Waller was, sort of a very tight accountability group, I suppose, and just wondering how we maintain that while also sort of potentially opening up the oversight board to more agencies.
I would agree with Dr. Waller's input there, that we do want to keep this quite tight. While we could kind of expand governance to include multiple different agencies, we want to keep this very focused to the prevention of violence as well, and focused on folks and organizations who are working in this space to make sure we do get things done, because we do know if governance expands too big, sometimes we risk losing impact. So that will be a natural tension, I think, moving forward, that our stewardship table and partners that we're working with need to try and find that balance of. And I think that's where we can make sure we're tapping into and creating strong connections with other governance models in the city to foster that shared vision we're talking about without necessarily having to bring everybody into the fold of the oversight board and all of that.
Yeah, and I think I'm pleased to hear that. Like, I think the stewardship table, you know, I think without too much tweaking could really become the oversight board fairly effectively. And then it seems like the strategic working group and the operational working group are opportunities for that expansion to happen. But appreciate it will be an ongoing conversation and certainly some tensions. You know, I was speaking to our speakers just about how we are ensuring that we're providing capacity so that organizations can take part. I know that often, you know, again, I think I heard 6 youth workers. You know, given their caseload, it's going to be very hard for one of those youth workers to take a day a month to take part in some of this convening and collaboration. So is there thoughts? I know that we do offer an operating grant. Are we looking at maybe being strategic so that operating grant could support the capacity for these agencies to participate in some of this work?
I think that's something that as we continue to move through this next phase of a needs assessment, as we have a clear understanding of what those limitations may be, we can explore how we may need to support funding and investments around that space or advocate for more of that going forward as well.
Sure. And Ms. Glatley, you wanted to jump in there?
Yes, my apologies for the habit of hand there, but just wanted to include as well that the 750 allocated from City Council for this on a per year basis is not the only funding that we have. And of course, as you mentioned, not only do we have operational funding across the city, but we also have funding through FCSS, which was mentioned in the presentation, as well as our CSWB grants. And some of those focus specifically on collaborations and how to bring folks together to solve some of the unique needs we have in Edmonton. So when we think about the investment strategy for an initiative like this, we're looking at all of those avenues for funding and how to best leverage them to move the initiative forward.
Great. I really appreciate that. I think that's an exciting opportunity. I have a little bit more to delve into around funding, but maybe just like a standalone kind of random question. I know that we identified that the high number of correctional facilities in the area are part of the dynamic of our community. So in subsequent phases, will we be doing some intentional outreach to correctional services?
This is something that we've definitely taken note of as well, and looking at our data in the preliminary needs assessment. So that is something we can consider in our follow-up.
Okay, great. Yeah, I think it's some great opportunities there around exit plans and even those interventions while folks are in custody. I'll leave it there and come for some more. Thank you very much.
Thank you, Councillor Stevenson. Mayor Sohi.
I will just follow up on that, but before I do it, I want to thank you for your work, and I really want to thank APS for being here today, and having someone senior leadership here means a lot to us. Thank you so much for that. I will follow up on Councillor Stevenson's questions. Yes, there are unique circumstances or factors that are driving more violence in our city. Correctional facility is one of them. Us being a healthcare hub as well, people coming here, falling through the cracks. There are other unique circumstances as well. So would you, if this is approved and received for information, then you work on those 3 pillars as part of pillar 1. Would you be engaging with some of those external, you talked about correctional facilities for regional municipalities, First Nations communities, and Treaty 6 Confederacy? Will you be, if you haven't, would you be reaching out to them as well?
Yes, engaging with our MOU partners was part of our preliminary needs assessment, and we plan to continue to further that as we move forward into this next phase. And then I think, as was highlighted in our goals, and one of the city roles here that's really important is that we do have that ability to really help our other partners and other orders of government understand what our localized context is. And we know there are very unique circumstances that are driving some of those needs. So I think this is what helps ensure the city is well positioned going forward to have those discussions with those other players.
Warren?
Yeah, no, I was just going to add on. I think the last two questions are pretty relevant. I think we all have a lot of levers we can pull, and that was also within that need assessment to try to look at who already has what partnerships, who's working with what. We do quite a bit of work with corrections through our integrated offender management program and through our youth program. So I just wanted to raise that is a big part of this, was understanding already who is doing what and part of that inventory of the ecosystem.
Got it. So my next broad question is that you go ahead, you work on these three pillars, you come back, there's timelines for you to come back. Would you come back with saying, okay, if we have $10 million, this is how much we can do. If you have $20 million, this is how much we can. You heard from Dr. Waller that if you have $25 million, you can probably significantly reduce violence in our city, right? That's kind of thing I'm looking at, and I think we can have a conversation how to find those resources and supplement the work that is being done already.
And as part of this next phase of work, we actually do have an investment approach being built out right now in collaboration with post-secondary academics to inform what that looks like. So we will be able to take a good look at our city funding, which we've noted is limited, but then looking at what other investments would be needed going forward, and that will inform what next steps we need to take.
So will that be kind of targets, for example, if we say $30 million or $20 million, say $20 million will get us to, over 5 years, 30% or 40% reduction in violent crime, or violent incidents, or violence overall, right? I think if that's kind of conversation we want to have, I'm ready to have that conversation, because we need to, EPS is doing a phenomenal job. There's good stats coming out of there too, right? And but we need to work on those prevention side and upstream side, right? So if you can put that kind of plan together, then the ball is in our court to support you.
Yeah, we'll definitely look at that. We want to stay on side of our chief financial officer, not bring you service packages outside of the regular situation. But certainly, like we did with our affordable housing, we'll let you know for this level of investment, you can achieve these kinds of goals. We can certainly take that away.
Okay, I like that approach, because I think we built up our affordable housing investment plan over time. Now it's sustained, I think, is $18 million ongoing every year, right?
Yeah, that's correct.
So if you can take that kind of approach that says we have we have money in the CSWB, we have money in FCSS, and there might be opportunity for reallocation or redirecting, but if there's additional resources required, this is important work, right? So is that kind of what you would bring forward?
Yeah, and I think that the needs assessment, I think, to Councillor Rutherford's earlier question around, concerns about getting stuck in whatever phase, is that governance and that consistency, and we've got to take our time, right? If we rush to a thing, we might miss many things. So we thoughtfully worked for 11 months with over 70 organizations in the community. We've been listening very carefully. They're going to be the arms and legs of this, and we have to be really thoughtful in how we work with them. Do the needs assessment, come forward with what is the best way to leverage all of the capacity of the system for maximum impact. Those are the conversations that we're going to continue to have.
Okay, good. Thanks.
Thank you, Mayor Sohi. Councillor Salvador?
Yeah, thank you so much. Really appreciate the discussion so far and all the work that's gone into the blueprint. Maybe I'll just pick up on some governance questions as well. And yeah, I guess, recognizing that the intent is to take a whole of society approach, having those strong relationships with other orders of government is going to be really critical. I saw that the implementation plan also includes an intergovernmental strategy. Obviously, that work hasn't been done yet, but just wondering if you could speak to what is the intention with the intergovernmental strategy, and what would we get out of that piece?
Following some of the discussions that we had through the preliminary needs assessment, we recognize that some of the levers to making investments to different jurisdictional spaces in this violence prevention space fall beyond the municipal jurisdiction. So that's where we're identifying key relationships that we need with other orders of government, and we have been able to start building those as well, and we do hold some of those based on the nature of our work. But that also positions us going forward as part of the investment plan to look at where other orders of government have funding, investments available that we can leverage and maximize impact of those investments. So that's part of, or some of the components that you'll see in an intergovernmental strategy to this work.
Okay, that's really good to understand, and I see such a direct link between what that strategy looks like and our ability to leverage additional funds and dollars, and just to ensure that we have that adequate and sustained funding going forward. Maybe on that piece around adequate and sustained funding, I know Dr. Waller spoke about the importance of having a business case as well. Yeah, where does the business case and some of those dollar figures around cost avoidance factor into these conversations? 'Cause I think that can be a really powerful tool for just setting the stage for those conversations around adequate funding.
I would suggest that the intent of the investment strategy is to build out that high-level business case, and then we can get a little bit more specific as needs assessments are informing pieces at a more localized level. I see Stacy has also unmuted. Stacy, did you want to elaborate on that?
Sure. So as we're moving forward with some of these key strategies, we're really taking that strategically whole approach. So that includes bringing together, again, our corporate plan, our community plan, and so on. The intent of the needs assessment really is to be able to articulate and have an intelligent understanding of the status quo in Edmonton. What does that actually look like and how is it experienced here? So that when we're having conversations with our intergovernmental partners, we do have that strong narrative, that business case that explains exactly where do we have assets that can be leveraged, exactly where might we have acute needs, where we need some filling, and what can that do when those are filled. So that needs assessment is really sort of the bedrock of building that business case, and that again, intelligent understanding of our status quo.
Great, thank you so much for that, and that's really helpful. And just to again, I'm just reflecting on some of the comments from speakers, and the one that also stood out to me is the importance of having it was described as a high-level office. Now, do we feel that the current model essentially fills that role of having a high-level office? Yeah, looking for some additional thoughts there. If our approach is meeting what was described by Dr. Waller.
Maybe I'll speak to the stewardship table as I sit there as well. And I think in Edmonton, the appropriate context is having I would call it high-level offices. They're really the way that our governmental system works, and quite frankly, the way that our community center works is that we have a lot of partners working together. There isn't sort of a central control mechanism that can direct the work of all of the other areas. And so what the approach that we've taken is really to understand where are those high-level offices that do have access to pulling levers where we need to pull them across the community and bringing all the voices that we need together to affect the change. So sort of my read on Edmonton is that generally an office can't get us where we need to go. And so we need to come together to make that happen.
Great. Yeah. And I think that, it's obviously so important to adapt that model to an Edmonton specific context based on our jurisdiction and legislation and different orders of government and authority that have different tools, etc. So that's wonderful. I may come back for another round, but thank you so much for those responses.
Thank you, Councillor Salvador. Councillor Tang.
Great, thank you very much. I may need a few rounds. A lot of interest in this report. Thank you all very much for being here. Obviously, lots of work, lots of strong relationship building happened in the last 11 months. I'll start as well, kind of in the stakeholder governance realm. You mentioned in the presentation AHS is part of the stewardship table, but they're not here, and obviously there's lots going on there. And I guess I just want to know, how that they're going to be here, moving forward, and what are they going to contribute, and how are we going to really tie in some of the healthcare outcomes and data, et cetera, into this conversation.
So while our colleagues from AHS were not able to be here specifically today, they are very committed to moving forward with us in this work, and we're already starting to work quite closely with them, even at an operational level, where we speak under Goal 2 about alignment with NET and the EPS crime reduction plan. We are having conversations with some of our colleagues in AHS at the very localized neighborhood level, looking at the public health promotion programming they have, how that fits in. And while we know there is restructuring happening right now within AHS, they are still very much involved and continue to maintain that involvement, we'll keep working with them and look to them to advise at any point if some of that shifts.
And to Chief Trikel, you started this previously as a deputy, and moving forward, I guess I just want to hear maybe some reassurance of that, this senior level of involvement.
Yeah, absolutely. If it's not me, it'll be one of the other deputies, I think, especially as we move to that governance table. We're a big believer in this governance. We're trying always to align with all our partners out there, and I think this is a great table where we can sit and have these discussions and plan. Yeah, and I think there's multiple levels of governance. We talk about public safety governance, we've got reach, and I think they're all just tying this together, so there's a commitment.
Yeah, and certainly it's very operational, in nature, which feels quite different than perhaps governance we've talked about in the past. I see you've engaged the school divisions. I see them as a pretty critical piece to this as a systems player. Can you talk a bit about their involvement in this?
Definitely. So both the Edmonton Public School Board and the Edmonton Catholic School Board did inform the stewardship table along the way, and we do have commitment of the school boards to be involved in this work, and part of what the the violence reduction model looks like going forward too within governance.
Great. Because there's such an emphasis on place-based, I'm seeing a lot of the sort of community organization of various social agencies, organizations that are very oriented towards the subject matter expertise related to violence prevention. But because it's place-based, I also just want to flag the Edmonton Federation of Community Leagues really at the neighborhood level. I see them playing a role too, and if you haven't already, I hope you continue engaging with them. And then REACH. So I just want to get clarification, right? REACH was created to be that convening body around safety and violence prevention, and now we're talking about sort of city-led with everybody at the table. Does that still align with your mandate?
Absolutely. It's, up to this point, REACH really focuses on project-specific coordinating and convening, whereas this is a
higher
level
level
above our system. So our city partners have been excellent in convening this work together.
That's a really good
and
distinction.
REACH has been, hand in hand with the city throughout this whole process. So it's been a really good partnership, and REACH is really excited to be part of this work going forward.
Yeah, and I certainly don't see any one of you doing this on your own when there's so many outside or different players involved. And then just finally, we see so many initiatives, I would say, face a lot of challenges to take off really when it comes to the governance structure. It can get overly burdensome. We try to include as many people as possible. Why is this different? How do we prevent that, I guess? Yeah.
I think really tying it to the operations, as you noted earlier, we are connecting operations right now and identifying groups that are already working in this space. And while we will need the support and partnership of many across the whole sector, I think really building off governance at that operational level to start with the strategic whole of system approach in mind with who's around the table, that will be key to making sure this doesn't grow too big, that it's not unmanageable, as Councillor Stevenson noted as well. There's that natural tension, and we are very mindful of that.
Awesome, thank you. I'll come back.
Thank you so much. Councillor Stevenson?
Thank you. So wanted to drill in a little bit more around resources and step two, where, I'm feeling a strong sense of urgency, recognizing the really important work in goal one that needs to be done as well. So could you tell me a little bit more about what the opportunity to action phase of rollout this year looks like? And it really just comes down to this question of whether we're going to be able to scale up proven interventions sort of this year and prior to the finalization of the second needs assessment.
Absolutely. So simultaneous to us doing this preliminary needs assessment, we've been able to start testing some of the way that we're sharing data across our organization. So with EPS, the city, some of the different data sources that we shared within the report to really focus in on different areas that need immediate intervention or that may have immediate solutions available. So in that way, back to Councillor Rutherford's question as well around what we're doing with the funding this year, we are able to quickly test what we've called proof of concept opportunities, looking at those specific solutions needed, getting funding out the door to pilot those solutions or scale up what's already working, which we noted.
Okay, so I think I maybe need to hear that a few more times because again, I'm hearing sort of piloting, but it's really that scale up that's of greatest interest.
Councillor, and I'll just add as well, like one of the things that we're doing is we are continuing to roll out like our crime reduction plan, which is focused heavily on violence. So we're not going to sit still from the police service perspective. And that was why it was important we got to the stewardship table, because we want to make sure that we're pointing in the same direction. So you'll see results, and we're hoping to see results immediately as well in that short term, but it's just making sure there's alignment with the strategy.
I might add one more further thought when we're talking about piloting too, but the proof of concept, this is really talking about piloting our new way of working together with the shared vision and governance as well. So while the solutions may be things that we're scaling up because they exist, partners, programs in the community that we've talked about, sometimes when we're saying pilot, we are talking about this new way of working here with the blueprint.
Okay, and so again, so not like I don't mean to make funding decisions here or pick one organization over another, but you know, we heard the capacity from 2 organizations today to start to scale up their proven programs within months. So are we planning to get some of those resources out there this year to help that happen?
I think this is where, with the initial goal of that strong governance approach too and data sharing, understanding those local needs, we can look fairly quickly to make strategic decisions and investments based on what we're seeing across systems and sectors and looking at what does exist in the community that works already.
Okay, and then I think I just wanted a bit of clarity with the $750,000 a year sort of appropriation from community safety well-being. Am I correct in understanding that's only for 2 years currently?
Do we have Kelt on the line that she can respond?
Hi there. Yes, that's correct. The funding is multi-year for 2 years, ending in 2026.
And can you remind me that, I guess it seems like making it multi-year for just 2 years is a bit limiting. So wondering what the group thinks in terms of having greater assurance around the longevity of this, because I mean I think it's 750 plus. I don't think we want to keep you only at 750, but just having that baseline so that you can start to make potentially longer term funding commitments now rather than feeling like there's only a 2-year runway here. Maybe to Ms. Flaman. So I believe community safety well-being will be an ongoing funding source. So just wondering your thoughts on committing to that 750 as ongoing rather than multi-year.
That's something that we can take away. There's such tension between the rest of our pillars around well-being, safe and inclusive spaces, anti-racism, equitable policies, and the such. So that can be an internal conversation. You know, there is a limit of how much those dollars are, and we can make different decisions and we can shift things, just knowing that when we say yes to one thing, we're saying no to something else, but we can certainly take that away.
Great. Well, I think I'll come back. Oh, sorry.
Yeah, I'll just note that that's part of the intention of the investment strategy. Again, the 750 isn't the only funding that we have here. And quite frankly, there are other sources of funding in some ways which are larger, which address prevention. So really taking that second level needs assessment, looking across the various funds that we have, as well as the external and intergovernmental funding. What can we do with that? And then what do we need going forward?
Okay, I'll come back to dig into that a bit further. Thank you.
Thank you very much. Mayor Sohi?
Yeah, so this council has taken public safety very seriously. We increased EPS funding, and I absolutely stand behind that investment. We invested in TPOs, and we invested in crisis diversion, housing, sporting reach. Are those investments paying off? Are we seeing results, positive results of those investments?
I think just first from the police perspective, we know we are seeing reduction in some of our crime stats, as well as, we do see that some immediate results in terms of violence around, especially our shelter district, those kind of efforts. With the recent also announcement with the kind of more alignment with the peace officers and police, we're optimistic we can be a little more present and visible in some of those disorder areas to kind of prevent that violence. So
Yes, so those are positive trends,
Absolutely.
right? And would this be kind of building on those successes and focusing on prevention and upstream investments?
Absolutely. And I think you heard from the public speakers today. There's a couple things. One is the value of those programs that we find as an organization because of the referrals and the partnerships we have with both of those organizations as others. So it's very important. I think what's also to note is, looking at Dr. Waller's presentation, there's a lot of things that are already occurring somewhat. It's just to the scale.
Yes.
So I think that that's also important to recognize this whole discussion is how do we scale up some of those efforts? I think two comments are intervention, we need to do more. Number two, youth are absolutely one of our most under-supported groups right now in terms of what we're seeing from violence. So those investments need to continue.
Okay, so if we focus on young people, right, and intervention, prevention, and how would, for example, I asked this question to UCAN. A lot of young people interact with our folks as well, right? Libraries, rec centers, transit. Like, how do you see city departments kind of fitting into this conversation?
As part of our preliminary analysis to inform this report, we did engage with many folks across administration, different working areas, and we do see that there's lots of opportunity back in looking at our municipal levers, and that will be part of what informs our own corporate plan going forward as well, thinking about where there's different spaces across administration that contribute to this work.
Right, whereas I go to rec centers and I see a lot of young people engaged in playing basketball, other activities, but we also see theft at those facilities, vandalism at those facilities. But our staff is not really able to intervene in those kind of situations because that's not what their training is, or provide support, kind of social. Like I think library has some social workers, but we don't have social workers in our facility other than transit, right?
Yeah, that's correct. And in our, we do have our security guard complement that they're excellent in how they can de-escalate different conversations. But we've been working very closely with, as Chelsea had mentioned, with our school boards, in understanding what the role of the city is. And we've actually increased our youth participation by providing an even lower cost option for youth drop-in after schools or during lower times of capacity in our system. So we're working really hard with our partners to create those opportunities for recreation so that we don't have those idle hands that we were hearing about earlier.
And also under our city plan, we have a target of making our city the safest city by 2030, and we're only 5 years away. I am really interested in what we need to do next along with all the other investments we have made. So, and going back into, again, into Dr. Waller's presentation, do you see that kind of potential here of setting targets and then saying, this is what we need resource-wise? Coming back to my earlier question, I just need absolute kind of clarity on that. Because I'm really excited about this work.
Absolutely. So all of our work around community safety and well-being is driving towards a safer and more inclusive city for all Edmontonians. The element that we're speaking about today is yet but one element of that, and we're trying to knit together all of our work with all of our partners. The city alone cannot accomplish that goal.
Yes, of course not.
But I think what we're demonstrating in today's conversation and in other conversations that we're coming to the table with is that we are arm in arm with our partners. We are recognizing the capacity. We are being an advocate at the intergovernmental place, knowing that we can't fund it all, and just making sure that our partners are aware of the other opportunities that are available through the province and the federal governments.
Yeah, thanks.
Thank you, Mayor Sohi. Just take my turn here for a sec. So I kind of alluded. So one of the things I'm struggling with is sort of, we did a needs assessment, but now we're going to do a phase 2 needs assessment. But we're going to scale up proof of concept projects. But I don't see anywhere in this about sort of that asset mapping or asset, like those great examples of things that are working well that have the potential to scale up. So because I feel like there's a very before you answer that question, I want to be very clear that in my knowledge and expertise, a needs assessment and an asset approach are very different, and they're not the same. So please do not tell me that you're going to be looking at that within a needs assessment, because those are two very different approaches.
Absolutely, and I appreciate you drawing that distinction between the two. Under our key opportunities, under Goal 2, we do talk specifically about developing an inventory of violence prevention initiatives and programs in Edmonton that will work with specific communities. We also talk about, a little bit further on under our Move Upstream goal, working with communities to identify social infrastructure, community-based assets, social networks, and social capital. And that is part of also working with our partners to build out that asset mapping of what we have in communities, because we do believe that that strengths-based approach is needed too.
Okay, but like, for example, an inventory is usually agnostic to whether they're effective or not, as an example. It's just what's out there, as opposed to whether those things are effective, whether they're resourced properly, whether there's outcomes that are being achieved and could be scaled up. So like, this is what I'm struggling with. I feel like we're going to be spending a lot. We already identified needs, and now we're going to go and do a phase 2 needs assessment, and then we're also on the side going to do like a strength-based approach. Do you see, like, it feels like a lot of work when we, I think this is the tension that Councillor Stevenson shored up, and I think Mayor Sohi too, to an extent, in their line of questioning around, like, if we already know what's working, why wouldn't we be just dogged with that?
I think part of the ongoing needs assessments and keeping ongoing to inform this work as we keep trying to have that two-pronged approach of action, proof of concepts, while we're better understanding needs, assets in our communities, is going to be really about dialing in. So yes, we have a lot of stuff that we know is working, that's been proving to work in, while we build out the evaluation framework that goes along with all of this, which will include process and outcome evaluation. I think it is that dialing in piece, just to understand where we need to focus in and where we need to support in a more targeted way.
And I want to just be clear, because for me the distinction is a needs assessments creates clients and services and programs. Asset mapping and strength-based approaches create citizens, right? That feel a commitment to their community, to making it better. So I'm not going to belabor this point, but I do think that is a flag I want to raise in this.
Yeah, and I appreciate that distinction. I think what our team is trying to ensure is that as demographics shift, as we see differences in immigration, Edmonton became home for 64,000 more people. If we're building it for yesterday, we're going to miss tomorrow. And I think the iteration
So the
piece,
nimbleness is the key.
Absolutely.
And responsiveness. Okay. Which is that like loose tight fit theory, which I could geek out with anybody on if they'd like to. I also keep hearing this thread about like the city funding is limited, but I want to kind of reinforce what Mayor Sohi said around, like, in the report, it discusses that you may, it says, what does it say? Expects to provide an update of progress in 2026. And I found that language to be very interesting, because is it expects or you will? Because it's a key time period in terms of before the next 4-year budget debate, as we're grappling with a lot of the funding decisions we're going to make, as we're looking at things more holistically. Are we having that conversation, and are we being bold in what is actually required to make a dent on violence prevention?
Absolutely, yes. We are keenly aware of the 27-30 budget cycle, and everything that we're doing, we are focusing in on our time and attention and our capacity to make sure that we are as prepared as possible to give our best advice to leverage those constrained dollars to make the biggest impact. So that is very much on our radar.
And so is it, because again, as how it's written, is it expects, so can I get a confirmation that there will be a check-in in 2026 on the violence prevention?
Done.
Okay, thank you. Councillor Stevenson.
Yeah, thank you. I just wanted to circle back to the CSWB fund. So when this strategy talks about review and refinement of city grant programs and investments to maximize impact, will that include looking at community safety well-being and how it's been used so far?
Absolutely. Kelta, are you on the line? Do you want to elaborate?
Yes. So we have a few different pieces of work that are already looking at how to refine and build on our CSWB funding since 2022. So one is actually going to come to council as a memo about all of the CSWB funding. And I know, Councillor Stevenson, that was of particular interest to you. We, of course, shared our recent progress report in January with you about how all CSWB funding has been used. And these and some other inputs will be what we base our next budget cycle preparation on. So we'll be working with all of the initiatives we currently fund, understanding impact, and then, as you say, thinking quite in that macro sense about what can we look at for the next budget cycle. So this is definitely in scope with work that's already underway.
Okay, and I guess maybe just, sort of aside from the memo, I always feel there's a tension when we don't actually have these reports in front of us at council and we can't have these types of conversations. I think sometimes it's easy to lose the thread a little bit. So I'm understanding you mentioned there was the progress report in January, then there'll be another memo. And sorry, what will that memo is going to analyze the funding,
Yes,
the effectiveness?
this was based on that motion you brought forward about how all CSWB funding, whether it is from the CSWB funding source or from FSR or tax levy, how all of that funding contributes to the achievement of the CSWB strategy goals and pillars.
And I think maybe where a gap exists, and I think it's a question for the intentions around the evaluation here, is I think there's a tension between evaluating the overall strategy, where we're mapping outcomes at a community level, but there's also the evaluation of individual investments and interventions, so what those direct outcomes are. Because I think there's two questions we have to answer as council. The first is, again, overall strategy, are we seeing the community level outcomes that we want? But then we're also having to decide, should we spend money on this or should we spend money on that? So will the memo provide that type of clarity?
So I agree that those are discrete but connected pieces of work. So for the memo, what you'll see based on the direction we have is that inventory of what is funded, how does it align with the CSWB pillars and outcomes. But the other broader part of your question, Councillor Stevenson, about what's actually effective, what should be areas of continued investment, that's the work that we're doing over this next year to prepare for the next budget cycle. So it's a very significant piece of analysis based on the metrics and performance measures that all of the initiatives CSWB funds collects and reports on. So yes, that is a piece of work, but it's going to take a little bit longer to pull that together, and it will be brought forward along with the recommendations we make about future CSWB funding investment. So we want to be able to tell you, was this a good investment? Was it effective? And would we recommend that going forward? That is exactly the information we want to bring forward for budget.
Okay, but that will be at budget, not earlier in 2026?
Correct.
Yeah, and I just wonder if there would be value in having sort of some dedicated space for that conversation, because it's a critically important one. And I think it also dovetails if we think about sort of early, Q1, Q2 of 2026. I think that's also when we might start to see some results from this work, from the Violence Prevention Action Plan, and a real opportunity to bring those two together and have some conversations prior to budget. Is there an openness to that?
We can certainly investigate that with our budget office to see what is possible and what makes sense, because we are also aware of well, certainly in 2025, the tight council and committee agendas. But certainly looking into 2026, we can investigate that with our business office partners.
Yeah, and do we need to provide direction on that?
No, I'm comfortable. Oh, sorry.
Oh, yeah. Yeah, maybe we'll talk amongst ourselves and come back. Thank you.
Councillor Tang, sorry I missed you previously. Please go ahead.
No
Take
problem.
all the 5 minutes.
No problem. I probably won you a few more after this anyways. And I'm going to try to ask my question to our city partners so that, I won't have anything after. I want to talk about evaluation. For the stewardship table, I guess wondering what this means for data sharing, because right now a lot of the data mentioned in the blueprint are public. Would the stewardship table allow for a mechanism to share more granular, perhaps not public data that will enable more effective strategy and tactic development on the ground?
Yeah, and we're already actually doing that as part of the stewardship table. Like we've actually got a secondment going, an agreement where we are sharing very granular data, which we weren't sharing before.
Awesome. That's a very concrete action. Thank you. And when we talk about outcomes, I assume, a lot of the ones named by Dr. Waller in his presentation, reduction crime incidence, severity, youth incarceration, and I'm mindful violence isn't just crime. We know that EPS has a lot of that data. We know that UCAM has very program-specific data. But the distinction here we're talking about is that the blueprint isn't to say go out and find new indicators. Your role would be to garner all of those things and consolidate, correct?
Yeah, and one of the pieces of work that REACH and the city have been working on, and we hope to expand even further, is through the Canadian Centre for Safer Communities, which is the national body that Irvin Waller was talking about. Edmonton has been part of a pilot project for the community and urban safety monitoring toolkit. And so that is something that we've been looking at and working at together to select indicators to monitor for across the city to assess the health of the city for community safety and well-being.
Yeah, because I think this, in the report, this one shared evaluation plan for all stakeholders, I feel like this is the thing that a few of us have tried to kind of get at through CSWB a number of times. I know I've had this conversation with Councillor Stevenson, Councillor Carmel, had inquiries about this, and you have it here in your next steps. And then just, I've also had this kind of conversation with police senior leadership previously, and I think the feedback I get is no one stakeholder is comfortable with the one shared outcome evaluation plan for everybody because you can't control all of that if not everyone's on board, right? But you're not resistant this time.
Sorry, what was the last part there?
You're not resistant this time to something like this.
I don't think we're resistant at all. I think it's just that there's always so many priorities, right? And that's one of the very first discussions we had at the stewardship table 11 months ago was about establishing governance, right? Because prior to that, we were working and are working in silos, right, to your point. Mm-hmm. So you're right, there will always be priorities for the service that may not necessarily align with the Violence Prevention Action Plan, but we can have those conversations through that governance table, have a better understanding at times, right? So.
Sorry, just a second to pause the time, please. Can we just confirm quorum? Councillor Salvador, Councillor Hamilton, can you turn your cameras on?
It's on.
Thank you. Okay, please keep going, Councillor Tang.
I think also, sorry, and through the stewardship table and through the agreement between the city and the police service is setting metrics and different thresholds within that crime data, what's important to us as collective rather than individuals. So that work's already occurring as part of this work.
And so because I know there's some questions about the intersection with CSWB evaluation. How does it duplicate, not duplicate the work there?
So we've been working closely within administration, knowing that the Blueprint for Violence Prevention is structured as the action plan under the crime prevention pillar to ensure that our evaluation and the outcomes that we're working towards are the outcomes defined under that pillar.
Okay, so then you're focusing on this one pillar, meanwhile guided by a bigger thing?
So most of our pillars do have an action plan, and that's intentional. So that we go vertical, but then we're also we have an integrating group of team or a team that looks across to make sure that it all knits together. So I wouldn't be worried about duplication.
Okay, and then just a final question around data. how do we get more qualitative data, which was mentioned in the report as beneficial?
I think as part of the ongoing needs assessment, we do have a specific note on community consultation, and that will be ongoing because that I think when we have looked at other municipalities and how they've really worked with different sectors to overlay data, it's been both that quantitative data and that qualitative data more on the ground to really understand those more targeted and focused areas that require intervention.
Great, thank you.
Okay, thank you. I think we're gonna pause here for a recess. We'll be back on this item at 1:30. Thank you. And as mentioned, Madam Clerk, if you can just add me to the list, because I can't add myself. And I will do a roll call of committee members. Councillor Salvador,
Good afternoon.
Councillor Hamilton,
Good afternoon.
and Councillor Stevenson.
Good afternoon.
Thank you. And there are other council members joining, but we will just continue on for the purposes of getting through this item. And I will go next. I did pull this item, so I would like to just move receipt of information. And then I will go to councillors. I wanted to be on the board to move this, to move the conversation along, and then I will go to Councillor Stevenson.
Great, thank you very much. I want to again really spend some time understanding the work that we're looking at around the resources. So maybe just to Ms. Flamen, what's the current plan with our CSWB funds for this year? Are we expecting any shifts?
Can you give me a bit more?
Yeah, so we typically, a lot of the funding that's there, or like we have some large pockets of grants, for example. And I believe that those grants often come forward for final approval from council, or we get a memo sort of saying what the grants have been dispersed on. Do we anticipate those grants having a greater violence prevention approach or focus?
Well, again, I think we try to balance that pot of funding across as many pillars as possible in order to have the impact. You know, those pillars were approved by council, and so trying to honor that earlier direction. But maybe I can throw it over to Kelta if she has anything that she can offer in terms of how the funding is going to roll for 25.
Yes. So we actually just announced the CSWB grant funding for this year. This was based on our previous intake and the number of different organizations that applied. All of the grants, I think you could probably say, contribute to violence prevention in one way or another. So, for example, funding was provided for RAY, which supports 2S LGBTQIA+ youth and their safety. We have some collaboration grants this year. We'll probably do a new open intake for next year. But for this year, all CSWB grant funding has now been utilized.
Okay, and so I guess then as we're talking about some of the work that's going to be happening this year, so sort of the evaluation of specific projects and their efficacy, how do we start to revisit and revise the strategy as a whole? Because I think you're right. I think council gave direction through the strategy that we're sort of equally focused on all the pillars. I think what we're hearing from from Dr. Waller, from others, is that if we want to see really dramatic results, we also need some really clear focus. So what is the process for reviewing and rethinking how we're using that fund, its relationship to the strategy? What's the next iteration of the strategy?
Yeah, so the strategy isn't that old, and I know everyone's very interested in seeing impact, but there needs to be, I think, some patience in that these longer term root causes take time in order to see the fruits of our collective labor. I think we've been very responsive to community, really listening to what those tables are saying to ensure that we are aligning with some of their mandates as well, because we again recognize that they truly are the arms and legs of this work on the ground. Again, maybe if Kelta, do you want to provide any more information about our outcome work?
Sure. Yeah, and I would say that's absolutely part of the regular cycle of the strategy. Many jurisdictions across the country have spent, a few years implementing their strategies, and then they look and tweak and make sure it's as focused as possible. So we're entering into that phase as well. From that first progress report of the first 2 years of CSWB, we had some recommendations at the end of the report on how we can improve focus and just continue to make sure that we're reaching the impact we want. So a couple things to highlight about work underway. One is refining our outcomes to make them more focused, to your point, so that we can really say these are the areas the city needs to focus on. We're also developing some investment guidelines for the CSWB strategy, and that will help decision makers and council know where can those best investments be made. And that's certainly related to some of the investment plans that are underway, such as for the Violence Prevention Action Plan. So we are in a bit of a tweaking phase right now where we're trying to apply all of the learnings in the last couple years to make some good changes over the coming months.
Okay, thanks. I will be back to continue on this theme. Thanks.
Councillor Tang?
I know. Okay. Some audio issues over here. Yeah, no, thanks for that. I mean, I had some sort of similar questions on my end, but maybe I'll just focus this round on what is different, because that's kind of the question I've been asking our speakers and also administration. I'm hearing lots of things and how it's different from past efforts. It's multi-sectoral. It's really distinguishing roles and responsibilities, and then that governance piece is very intersectional. It's very data-driven. But in the sort of the next step, I do see multiple reference to investment plan, implementation plan, et cetera, et cetera. Phase 2 needs assessment, right? And I think the last thing this council will want is plan after plan after plan. In the meantime, CSWB grants are going out, FCSS grants are going out, building, and then there's their own evaluation to go with that. And I'm seeing these two are happening parallel and there's no convergence. And then with risk of, say, council turnover, higher orders of government turnover, staff turnover, how do we prevent these plan after plan not sit on the shelf?
Because of deep community involvement and our partners not letting us sit on plans.
Yeah.
I think that's, they are as impatient, if not more so, because they're actually on the ground, not sitting here with us talking about the plan, they're executing those plans.
Yeah.
And I think you don't need one ring to rule them all. FCSS is prevention focused, and I don't want to leave the public any kind of impression that as this work continues to be refined so that it's absolutely precise, I don't want to spray and pray and sprinkle a little here and a little there and not have maximum impact. But I just want to remind council, we have an 80-20 investment with the province on FCSS.
Mm-hmm.
And last year, or the last funding cycle, we spent over $1.5 million in supporting Boys and Girls Club, who are working on mentoring, Indigenous wellness, newcomer wellness and social connections, focused on youth. 1.3 million through the United Way, focused again on youth and care. So we've got, I think, a number of investments already happening through FCSS, as well as CSWB. And because it's the same team, social development, that is working through all these different partners, all these different funding sources, we have excellent line of sight on where we are leveraging that investment with willing partners who are applying, especially for these various grants.
Right, and I see that partners on the ground in this blueprint for violence prevention, for example, with FCSS, there's very strong, long-standing structures that involves folks kind of on the ground. I don't know if I'm seeing that with, say, CSWB. And I think what I'm asking is, so what's going to be different? For example, are the FCSS folks and the violence prevention folks be working closer together as they kind of go through their granting process, right? Go ahead.
Thanks, Councillor Ting. So we are already working quite closely with our colleagues who oversee the FCSS investments for the City of Edmonton to talk about how we can align what we're finding through our early preliminary analysis, but also have them help inform the investment approach for this work going forward, being mindful of the spaces that they're able to invest. Stacey, I don't know if you're online, if you have anything further to add on that?
No, as you've noted, we are working closely with the different investment portfolios and CSWB by and large. We work very, very closely as groups and have really talked about the blueprint for violence prevention as being sort of that upholding, one of the big upholding strategies for the crime prevention and crisis intervention pillar. And so how that works in terms of rolling up in terms of investments and understanding the investment alignment, as well as evaluation, as well as how we're approaching internal corporate activities is something that we've been doing all along and have been intimately trying to better define, I think, for that community or for that conversation with council. It's a really big piece, CSWB. So making that something that's understandable is work that we continue to do, but certainly work that's being done behind the doors.
So I think I just need to know, like in 3 months, let's say, or sorry, for next year's intake, there is that internal coordination already to say, these that line up with violence prevention really speak to these outcomes we have determined as a community, and therefore, you know, and administration will have that capacity and empowerment to say, actually, it doesn't line up, and we don't make these recommendations. So I think I need that reassurance. But anyways, I'm out of time.
Would you like to just finish responding? Was it to that question from Councillor Tang?
Sure. So we take our fiduciary duty very seriously, and we have very clear parameters for each of our grant streams to ensure that the applicants and their project proposals align, and we score them based on that. And yeah, I guess the easy answer is yes, we continue to work hand in glove across these various streams, especially when they're pointing to violence prevention and to the community supports that are required.
Thank you. Councillor Stevenson?
Sorry, this tag team. Oh, so maybe just to build on Councillor Tang's question. So is it administration's understanding that violence prevention is council and community's priority?
Are you asking if that is above and beyond or separate from CSWB?
Like as we continue to sit with the CSWB strategy, what I'm sensing, maybe I'll just speak from my experience, is while still recognizing all pillars have importance, for me, I'm feeling the need to concentrate and focus on a single pillar, and that's around crime prevention and specifically violence prevention. So that's where what I'm sensing, that's what I'm feeling is the desire in the community. I think some of my colleagues may also be feeling that priority, but I'm not sensing that that's like, and I appreciate we haven't formalized that in any way, so I just want to be clear. It's not but I just want to understand what your understanding was.
Yeah, so we also know that anti-racism is really important. We understand that reconciliation are also distinct and major priorities. So no, we've not heard that we should be overprivileging crime prevention to the detriment of others. Because again, when we say yes to one thing, we're saying no to some other things. We do have all those pillars. We do not equally fund each of those pillars. You know, so we are trying to make advancement and progress. Not in a uniform way, but in a way in which we can, with the willing partners that we have, to advance the work as best we can.
Okay, so what would a process look like for us to provide greater focus in this CSWB landscape?
That is an excellent question. I don't know if anyone on the team wants to venture a guess. You know, I think the most obvious one is a motion, but I don't know if anyone on the team would like to weigh in on their thoughts.
Perhaps I could just briefly say that we've been doing a lot of work on community collaboration. We meet with agencies all the time, so we'd really want to make sure that there could be community voice in that conversation because we've committed that CSWB is community driven. I also mentioned earlier that we have been doing some work on focusing the CSWB outcomes already, and so we would appreciate the opportunity to share those as part of that broader conversation. I think we already know some of the directions we can and should go to make this more focused. And so some of that work is already underway, and that might alleviate some of the challenges that you're seeing Councillor Stevenson and commenting on.
Okay, and so again, the timeline for that work and when it would come back to council, is that what we were discussing, sort of the memo in Q2 next year? Or at budget time next year?
So we are working on a memo for council. The memo that we were referencing earlier in this conversation that gave the progress report is available publicly now. And the memo that we're working on is in May, which does provide the funding analysis based on your earlier motion, Councillor Stevenson. Tell me more about what you're looking for. Like if in a perfect world, what would you be wanting to see from us?
Yeah, so I think what Kelta just shared was, you know, there's some lessons learned, there's some areas of priority or focus that administration, informed by community, would conclude and come to a recommendation. I'm just unclear how and when that recommendation is being made, and what opportunity council has to weigh in on that or be even informed of that.
Kelta, can you provide a response?
Yes. So, I mean, we can absolutely follow up too with more detail, but right now what we're doing is the internal integration work for those outcomes. So working with FCSS, existing grant lines, teams across the organization to make sure that those outcomes are representative of many different pieces of work. So I think come summertime, and again, we can be more exact after I follow up, but around summer, we could share that via memo with council for awareness and feedback.
Yeah, and I think memos aren't a format for feedback, but happy to come around and explore that idea a bit more. Thank you.
Yeah, thank you. And I just would like to ask my colleagues to focus on the report in front of us if we want to have a bigger CSWB conversation. I'm not sure that this is the right format for that. We've had many things come, and we have the different pillars, and each pillar has distinct areas of work. If we want to look more holistically, I think we take admin's advice on giving them that motion direction to bring back a broader conversation on the CSWB. They have evaluation checkpoints. They've provided us memos. If that isn't sufficient and there's more conversation we'd like, let's give that direction. But I think it's separate from what's in front of us today, which is the Violence Prevention Action Plan. And we can talk about how far and how fast over time, but do we agree with the basic principles of the plan before us, and having the work that administration has said that they're going to do if this is received for information? Are we okay with that? So let's focus our questions there. Mayor?
Thank you. I am supportive of the three interconnected goals that you have identified as part of the strategy. But I have some specific questions. Maybe they were asked earlier. When we talk about violence, like what type of violence are we talking about? Like, there's a crisis of domestic violence in our communities, for example, right? Young people engaging into youth violence, right? I think so. What specific are we talking about?
So within the plan, we've really taken a cross-cutting approach to looking at violence. So with the public health approach, we did align our definition to the World Health Organization's definition, and that's recognizing that violence takes many forms, ranging from youth violence, intimate partner violence, hate crime, community trauma, and systemic violence. So all of those forms of violence are interconnected and often share the root causes. So taking that holistic approach helps us not limit ourselves, but recognize through ongoing needs assessments, we will focus in on those areas as data is showing us we may need to going forward with our implementation.
I know. I think it's important for us to continue to stress the interconnectedness and intersectionality of these issues, right? Even under the funding, whether I don't want to go there in that evaluation of that, but like racism impacts reconciliation, and young people being attracted toward gang activities because of that. I think there's all those things are kind of intertwined, right?
We would completely agree. And under our goal 3 of moving upstream, that's where we are talking a lot about working with the other strategies and frameworks under the different pillars, because while this is an action plan under the one pillar of crime prevention, we do recognize that it does touch on all of those other pillars as well in different ways. And knowing that this preliminary needs assessment and data did demonstrate some potential areas and issues of focus in our city, we do hope that more robust needs assessments would help us define and further prioritize moving forward.
Got it, yeah. Can you speak again about what the role of, like, this is not creating a new governance organizations, more of building on the current governance and refining those and strengthening those. What role REACH will play in that? REACH Edmonton.
I think REACH's role is really about supporting the coordination and convening from the community end of things, whereas the city kind of can take up more of a bird's eye view and reach into city systems better. REACH can go into help look at where we can convene communities and enhance programs that we know that are working really well and support evaluation, and also bring in some of our own national reach, no pun intended, through the Canadian Centre for Safe Communities and that sort of thing. So it's really been like we work alongside the city in this. So.
Yeah. First of all, thank you for being here. I know you're not feeling well, but you're here, and that speaks to your work and your dedication. So no, thank you. I know you're struggling with the illness, but thank you for being here. So my last question is around the intergovernmental aspect of this, right? Because this is very complicated. It touches on so many jurisdictional responsibilities of the other orders of government, and we have a role to play. How would that fit into this strategy? Part of that.
Well, I think part of our plan here with the intergovernmental strategy is really to define what our municipal role is and our jurisdictional role, but that also means really highlighting that key aspect that we have that clear local understanding. We spoke about earlier the unique context that some of the councillors flagged for Edmonton, bringing that to the awareness of our other orders of government and our partners in those other orders of government to help direct targeted investment where we need, and to support, as mentioned, REACH plays a huge role in convening partnerships and different programs, but where we can support intergovernmental investments into certain programs as may be identified through the needs assessment, I think an intergovernmental strategy positions us really well to be able to do that.
Thank you.
Thank you, Mayor Sohi. Councillor Tang?
Great, thank you. I think this might be my last round. I guess just want to, I feel like I can hear what the other folks other than city at the stewardship table would say. I'm hearing from some of the community partners, organizations, what they would like to see. In 5 years, we've garnered the funding necessary from different orders of government to put together that $25 million. You've done the needs assessment. I guess, tangibly, what is going to feel differently on the ground? What would residents say? What would businesses say, for example?
I think the overall goal is increasing the perception of safety in Edmonton and safety at that very localized level through these pieces of foundational coordinated responses and investments. I know some of the other jurisdictions we looked at in the attached jurisdictional scan, while early in their plans, so they didn't have fulsome evaluations complete that we could include at this point in time, they are seeing huge success by having these types of plans in place, such as Boston recently demonstrated quite significant reductions in their homicide rates. I think Irvin Waller had also mentioned that earlier. So our hope would be that when we set those, we work with our partners and with community to set those really key targets that we're looking at, that we do start to see that success over the next 5 years in meeting those targets.
And then I think, did I hear you earlier that the next checkpoint with council will be May 2026? I think that came up earlier. but I can't remember what it was a reference to.
I know we did commit to yes, coming back to council. I don't remember the specific.
Okay, just maybe a progress update?
Yes, we can look at that and take away.
Yeah, because I think, you know, I think council might want to be following that conversation.
Definitely.
Through various channels, of course. I guess one thing that's a bit of top of mind for me right now, and if you can just elaborate on the a bit of commentary, affordability was identified as a risk factor in this report. We're seeing mounting pressure for affordability, and we'll continue with, say, the tariff war that's supposed to go into effect tomorrow. What do you, like, how do you factor that in, and how would that impact the current violence landscape? What can we say, and what does this say about the resources required and the urgency of this moment?
I think from some of what we've seen through early data research, we know that poverty, affordability, that's one of the root causes that drive some of these concerns we're seeing in our communities. So as we continue to understand that data, understand again our municipal role in those spaces, there's also a strong advocacy role that we can play in bringing that data and localized needs to other orders of government that may have more control over specific levers in those spaces. But I think we do play a really crucial role in bringing that information and that data forward.
Okay, good.
And Councillor Tang, I think you highlight an excellent intersection. Like one of the other pillars of CSWB is pathways in and out of poverty. So it's a great signal of how interconnected this work is. And by having the Violence Prevention Action Plan as one of the action plans under one of the pillars, lends itself to being part of a larger conversation to see those connecting points.
And are we like doing anything on that particular pillar, Jen?
Well, I know a number of our grants are tailored to that. I don't have that list in front of me, but it is all available online. But we'd be happy to follow up with you.
Yeah.
Unless Kelta, do you have that stuff handy?
It's okay. I don't need further on that. I think, I guess, appreciate the chair's comments earlier about staying focused on this report, but because of the intersectionality with so many other pillars, I think my expectation for what is going to be different isn't individual pillars kind of granting things out in the community. Sometimes there may be overlapping. We don't even know, not just with the city, but maybe with other pieces. And if we're going to have a very robust evaluation framework, so I don't really know. I just feel like if we're going to do things differently with this particular blueprint, I want to be able to see that like across the board too, and not have those siloing effect anymore. That's all.
For sure. And even how different applicants are coming forward with their program proposals. They're not saying we're just going to do this thing. Even in how they describe the impact and the scope of what they're trying to do, it bleeds across many of those pillars. So even in how this is actioned, it is mirroring how we are granting to those actions.
Thank you.
Thank you very much. Does that conclude our questions? Perfect. Anyone to speak to this item? Councillor Stevenson, please go ahead. Yeah, you're on committee. Oh. I was going to let her close.
Well, thank you very much. Obviously, a very robust conversation today, lots of discussion, and appreciate all the feedback and input we've had as part of this. I am feeling a lot of confidence with the Violence Prevention Action Plan as it's been set out. I think it's informed by, very, very proven practices in other jurisdictions, and that we can build on that in the Edmonton context to our success. I think the three goals for me really crystallize, the very essential pieces of an effective strategy. So, a structure for sustainability and governance, taking action and addressing near-term challenges, while also keeping that focus on going upstream as well. I think that where I feel tension, or where maybe I'm struggling, is, this work being so robust, I think puts some of our previous strategies around this into contrast with that, and I, council has been part of those strategies step by step. We've directed funding decisions, and I think what I have been feeling over the past number of years is the really critical importance of focus. Focus is a very hard thing to do when we recognize that there are interplays and multi-dimensions to the issues that we're tackling. And I think maybe the difference is bringing focus to the outcomes we want to achieve, recognizing we need very holistic solutions to achieve those. So moving forward, and I think, appropriately noted, not necessarily the venue for it today, but I think that there are conversations and very important conversations to be had about how we continue to move forward with community safety and well-being, how that strategy informs our work as a city and the funding that we provide. And that is, for me, that's the biggest and most important conversation that I hope we can have. Not to presuppose, and I think continuing to hear from community is very important. But thinking about how we can take that holistic framework and start to narrow in on some specific outcomes that we want to achieve as a community, and then use levers within each of those pillars to help us get there. So ongoing conversations to be had, but I am excited by this work. I'm particularly excited to know that this is a year of scaling up, that we can build on the strengths of programs and projects and collaborations that are already happening and start to make some really tangible differences in people's lives right now. And the ongoing work for evaluation, governance, and going upstream as well. So excited to keep tabs on this work and for other important conversations to come. Thank you.
Thank you, Councillor Stevenson. Councillor Councillor Hamilton. Sorry, I meant Councillor Hamilton. Thank you.
Thank you. I appreciate the discussion today and a really robust, the questions, the curiosity. I'm delighted to hear that the commitment council made in 2021 to becoming the safest city in Canada by 2030 is still really present in a lot of people's imagination and in their own mind, because that was something that I had championed. That was there because I put it there, and I still believe that we can be the safest city in 2030. But so much of I think what I wanted to say on this is that I heard so much of the sorry, I'm in another meeting right now and it's a little distracting, but so much of the let's see if I can, sorry, I'm just trying to make it go away. Anyway, so much of the stuff that was brought forward today by administration is something that we heard back in 2020 as part of, I think, EPS's Vision 2020. And I have reflected a lot in the last couple of weeks about how some of the ideas that were brought forward at that time stalled out, and maybe why they stalled out, or it didn't come together in quite the way it had been envisioned at the time. And I guess my only hope in done great work. I think that there's a wide body of evidence that supports this, as there was 5 years ago. I think, like I was saying, something that I reflect on quite a bit is, the things that get lost along the way. And so my hope for the next 4 or 5 years of this work is that it doesn't get lost along the way, that hopefully for all the challenges that come with building relationships and being a convener and being at those tables, that aspiration for our city, which I don't think should be that aspirational, to build a place where everyone can feel safe, doesn't get lost again. So I just wanted to say thank you, and I look forward to seeing how the tables are convened, but mostly how this work is executed on going forward. Thank you.
Thank you, Councillor Hamilton. Councillor Salvador?
Yeah, thank you. Just wanted to take a moment to thank the team for all their work to date on this. Pulling Blueprint together has been a lot, and being able to digest how much has already gone into this work. It's been a really excellent morning of learning and communicating what has been done and what's to come. And from my perspective, I see this work as an important foundational step towards a more strategic and coordinated approach across sectors to address violence in our communities, and really appreciate the recognition and rooting of all of this work that violence is preventable. And the application of a public health approach, I think, is incredibly smart and strategic. You know, violence prevention is something that I hear about from community members all the time. And when I think about all of the work that we need to do to create a safe community where everyone feels like they belong and like they are cared for and safe, this is a really important part of that. I'm also thinking about all the organizations and programs and frontline folks who are doing incredibly important work in this space. And what this approach underscores for me is how critical it is to ensure that we're aligning efforts and that we're scaling approaches that work and directing resources where they will have the greatest impact. The blueprint also highlights that this work isn't something that the city can or should take on alone. It recognizes that other orders of government play a critical role, and if we want to see meaningful results, not only do we need full participation from all of those important stakeholders and other orders of government, but we need adequate and sustained investment, which is why I'm particularly interested in the work that's to come on the investment approach, as well as the intergovernmental strategy. I'm also keenly interested in the accountability framework and evaluation, which of course will be critical to measuring progress as this work unfolds. So yeah, I want to thank my colleagues for the thoughtful conversation and questions today, and again to administration for setting this important foundation. Looking forward to the work that is to come. Thank you.
Thank you, Mayor Sohi.
Thank you so much. I really want to thank administration and the partners for working together, including EPS, and look forward to further collaboration. I absolutely understand the impact of the ongoing violence that is having on people's lives. It's unfortunate that Edmonton has consistently ranked high on the in terms of violent crime severity, particularly. And there are many reasons for that. One of the reasons is that we have the highest concentration of correctional facilities in our city, and people get released from those facilities into our communities without a proper plan in place for integration. We saw that with two of our members from the Chinese community being murdered a number of years ago. We saw that at the Velvety LRT station when the fellow who alleged to have killed a father of 10, and that person was also released on conditions, but conditions were not met, and they ended up on the street and killed someone. And we saw that in Millwoods, where mom and daughter were killed by someone who was experiencing mental health issues. Right, so there's so much the pain and trauma in our communities that are being caused by the violence that people experience, and those who are being released from those facilities and their own life circumstances. We're also a hub for regional municipalities in northern Alberta, northern Canada, northern British Columbia, where a lot of people do come to our community for services. And when they fall through the cracks, they fall on hard times, and sometimes they end up in committing crime in our city. And those are the realities that we face. But despite that, we are making some strides in the right direction. The work of Edmonton Police Service, the work that the four organizations Reach Edmonton are doing, the crisis diversion teams, the investment we're making into housing, the changes that we made to derelict properties, the changes that we made to controlling knives in our communities, and many other things that we have done over the last 3.5 years are starting to pay off, but we have a long way to go. Yes, 2030 was a target, and I feel that we can achieve that target to be the safer city, but a whole lot of work lies ahead of us in that. And I'm really excited about this work. I am really optimistic that by working on these 3 focus areas and understanding the intersectionality of this work, that we will be able to make the right investments and working with the partners to really prevent crime from happening in the first place and violence from happening in the first place, but also take immediate action. So I look forward to their work, look forward to that report coming to us and the analysis and all the collaboration that community is putting together. So thank you to each and every one of you for the work you do. Yeah.
Thank you. Councillor Tang?
Yeah, great. Thank you very much. Appreciate the administration for this very in-depth work. I think there's a lot to be hopeful here. And just maybe building on what the mayor is saying about what is the problem we're trying to solve. I think over 11 months ago when I was working on this motion, just in my ward alone, never mind kind of across the city, hear stories from families, from parents, from communities about youth being bullied in schools. And then they get bullied in public spaces, in transit stations. You know, at the time, our city was seeing headline after headline of horrible violence happening in public places, in schools, in homes. In the meantime, we poured a lot of resources into law enforcement, in social service, in crisis diversion. Grants were going out in disparate funding streams, and I was not understanding what collective outcomes we were trying to achieve. And that's why at the time I wanted an action plan when working on this motion, and administration came back with something that's not an action plan, but I think one that is thoughtful, one that is different, and one that is focused on relationships, because as much as we want to see action happen immediately, if we want them to be successful and sustainable, they cannot happen if we don't have the buy-in from so many different sectors that play a role in violence prevention. And so, you know, to see some of the people, some of the senior leadership at the table in a way that they haven't been before. I mentioned earlier, it's not the first time we're trying a violence reduction strategy, but there's something unique here that we haven't seen before, and I think that's a huge accomplishment. And I just want to thank the team for really taking the time to form those relationships, to build that buy-in, to work across the sectors, because I think that's a huge undertaking. And I think why I wanted to focus so much on what's different here is, you know, I don't think it's enough, because I think everything we have seen that we were doing wasn't moving the needle in a significant way. And I don't think it's enough for the city to continuously offer grants, doing amazing work in the community for those organizations. But I think we need to say, as a system, as a collective, where should we be strategically focusing, and, you know, how can we constantly adjust? It's not just, should not just be up to the city alone to kind of look at some of those questions at the systems level. And to me, that's what's going to be different this time. So I think it's exciting to hear about the next steps, how this blueprint will grow and lead us forward through different areas of opportunity to bring people, bring community, bring young people, bring Edmontonians along with us. When I ran for city council, something that was important to me was using an evidence-based approach and bring a public health lens to city building. And this report, with the 3 goals of building in the foundation, addressing near-term issues, and also long-term upstream actions, really encapsulates that public health approach, which I think is truly going to make this long-lasting and impactful. And just to maybe emphasize, what do I mean by that public health approach? We are defining what the problem is. We're looking at social determinants and risk factors. We're looking at root causes to try and prevent violence long term, and using data to design opportunities and actions we take across the sectors. And most importantly, the inclusion of evaluation, which makes sure that we are accountable for the work we're doing, investments we're making. That shared outcomes across sector, I feel like, is something I've been calling for a very long time, along with many of my other colleagues. And I for one, am really glad that this blueprint offers that as a critical piece of work. So I look forward to following this work along to learn the opportunities. Boston came up a lot during the conversation, during the jurisdictional scan, and their reputation really changed from one of the most violent cities in America to one of the safest. And I think we can get there too. Thank you.
Thank you, Councillor Tang. I'll close. I won't be as brilliant as the people that spoke before me, but I do want to, talk about a few things that have shored up since this conversation. And I definitely hear that tension with my colleagues around the community safety and well-being funding writ large. How is it all interconnected, the evaluation of that, and then how do we also make sure we're focused on outcomes in each specific pillar, right? That's a big ask. And I think back to, we're still residually learning from the past. I think about the first fall supplemental budget adjustment in 2021 after getting elected. And one of the reasons we said we need to create this community safety and well-being framework, which is a motion that I put forward, was because I was seeing this funding as sort of like a slush fund for any idea that councillors had in relation to anything, and there was no kind of guardrails or boundaries around that. So then we had funding allocated, then we created this, so we still have some of those things. This is why I think Councillor Stevenson and others are right in they're saying of like, okay, as we go forward, now that we've got some of these key elements in place, we have more clarity, we have the community safety and well-being framework, we have clear understanding of what kind of spending we're doing in each bucket, we have certain strategies, like we have our murdered and missing Indigenous women and girls action plan as an example, we have the violence prevention plan. We have all of that. Now that we have all of these pieces in place, I do think that before the next 4-year budget or before a new council comes in and starts allocating any funding that is available in the Community Safety and Wellbeing Fund, there does need to be a bigger conversation on where do we get the best, where does administration and community feel like we will get the biggest outcomes within how we're spending our funding, and really being bold in those recommendations. And I think the mayor said it well, right? Tell us what the trade-offs are. Say, if we were to spend 20 million in violence prevention, these are the targets we think we can hit. But it does mean we're probably gonna have to slow down on spending in these areas. But that's a conversation that council, I think, should grapple with down the road for sure. But today, I think the plan before us is very sound. Because we do have to bound the system at some point. I think about one of my favorite philosophers when I was in my master's program, wrote a piece on complexity and social change, and said that one of the key drivers to actually seeing change is actually how and where you bound the system. Because, for example, if everything's, and we've heard it in different ways, and it's a fancy way of saying if everything's important, then nothing's important, right? If we don't have some sort of focus and some sort of eye vision on a specific area, we're not going to see that change. So this plan provides that in an area that I can't believe we've gotten this far, like Councillor Hamilton mentioned, right? This was mentioned in years past in councils previous about wanting to see some impact in violence. So that we're here today, that we're moving this forward is very exciting. I do want to caution as well to administration about, please with this funding that is available, even though it is not a lot, please break away from the default to grant programming. We heard that loud and clear from Dr. Irvin Waller, and I couldn't agree more. If we're going to say something is going to have an impact, let's work with those groups to create that consistent funding over a longer time horizon to provide that continuity and actually be able to see those impacts. So that's one piece that I wanted to say. And I think that this has also shored up a bigger conversation about some of the governance pieces around this distinction between admin and reach, which I didn't want to get into today, but I do understand that reach is supposed to be, you know, a convener and a catalyst and a backbone. But then I'm hearing administration is the convener and the catalyst and the backbone. And we transferred a lot of staff from City of Edmonton admin to reach to do that role. So I think there is an also bigger conversation that needs to happen there as well going forward. Thank you. Please vote.
Yes.
We have all the votes.
Please display the votes. That is carried. We're almost on our agenda. We have one more item, which is a motion pending, because we don't have any responses to council inquiries, no private reports. So 10.1, I will move that motion now for debate since it's mine. That administration bring back a report on options, including potential funding sources for responding to life, safety, infrastructure needs for EFCL and the community leagues based on the most recent building condition assessments completed to date, due Q3 2025. So I don't have to see the chair. I'll just do a brief introduction. I worked in collaboration actually with Edmonton Federation of Community Leagues on 2 motions, and this is part 1 of 2. The second motion, administration told me was going to cost us $370,000 to implement, which I can belabor that, but I won't. But this one is basically, the intent of this motion is to say we know there's still ongoing work and assessments that are being done for all the inventory in community leagues, like their halls and infrastructure, but we also know there's a lot that have critical life repairs. We've given a contingency funding for 2025, but we have a gap in 2026 that either we need to start directing them to create an unfunded service package for fall, or we need to think about whether we're going to fill that gap in 2026. So that's the intent and purpose of this report. And I can talk more. I have a bit of a briefing and information on what we mean by life safety improvements and those kind of things if you'd like to ask, but I'll stop there. Councillor Stevenson, questions?
Yeah, thank you. Actually, I think you spoke to it, so I just want to have it clear in my mind. So I think at our budget, we did approve a capital budget for what I thought was this, but that, I think what I'm understanding from you is it was only for what's needed in 2025?
Yeah, it was from council contingency, and it was for one-time funding for 2025, and then we'll have to have a bigger conversation about this. And I think there's a bigger conversation about some of the same ways we're talking about asset disposition and aging infrastructure. Like, leagues are experiencing a huge amount of aging infrastructure. And what is the city's role? What is not the city's role? And we haven't grappled with any of that. So that was the second part of my motion, which I can talk about in my closing, but this part specifically is just do we want to have some direction to administration to bridge that gap into 2026 before the 4-year budget debate?
Great. And so what this will come back, so if I think about our risk, like our asset management system, so let's say, I guess the way my mind works is that in, when we approve the funding at budget, let's say there were 100 community leagues that had life safety risk issues. And so the funding we provided, is it just that, I'm just trying to understand order of magnitude, like how much of a dent have we made in addressing this with the service package we did approve, and then like what's that gap left? Or is what you're saying is that there's sort of like an ongoing every year these types of investments? Because I guess my assumption is just at a certain point we address all the life safety issues, then we have a bigger question about condition ratings.
Yeah, so this is where I'll have an offline conversation with my colleagues about what was quite frankly a little bit frustrating, in these two portions, and, you know, we just approved a committee with apparently no resources needed to create a whole second committee on infrastructure, but to get this kind of work collaborating with the leagues was gonna be almost a bill of $400,000. But this portion is, I think I can't remember, and I don't have it in the notes in front of me. I believe there was like 12 community leagues across the city that had life infrastructure, like critical need infrastructure dealt with. So it could have been a furnace, it could have been a roof. So their scope and scale different for what the repair was per community league. I don't know, that would come back in this report, what an EFCL would say. They would likely come back and say, these are the leagues we'd recommend.
And those are above and beyond what we've already provided funding for?
Correct.
Oh, okay. Okay. So we maybe got the absolute worst 10. and
No,
now we're
because
like,
because we had the 10 that had assessments done to date at that point.
oh, so this
So
is
the
an
assessments are
issue.
still going
Gotcha.
on. Like some leagues haven't even had their assessment completed yet.
Perfect. Thank you. That's the piece I was missing.
Okay.
Was that there are issues that had not yet been identified when we approved the funding package. Ongoing work is happening to identify those issues. We want to make sure there's funding so those issues
Yeah,
can be
because
addressed.
if it's a life structure issue, like I get there's bigger conversations we need to have about like league disposition and those kind of things, but if there's life cycle issues, we might not want to say, oh, just wait another year till we have the 4-year debate.
Totally. Yep. No, that's great. I appreciate you bringing this forward. Thank you.
Thank you. Any other questions? Anyone to speak? I will just close. I'm glad to see that we're going to have this conversation. I think even the questions from Councillor Stevenson have shored up what I know is a bigger conversation that we need to have about this infrastructure, the tripartite agreement, what role the city plays, what role the city doesn't play. It involves IIS and it involves community services. But I also do think that there is an inconsistency that we are seeing and I am experiencing as a councillor around when things have a price tag to them and when things don't. And the order of magnitude of what I mentioned before of striking up an entirely new committee, an infrastructure committee, where we're going to have city clerks sitting in this room, we're going to have DCM sitting in this room, and we're going to have staff admin sitting in this room for hours and hours that didn't come with any costing whatsoever and went through. But when we ask for something like this, it's all of a sudden $400,000, which is going to be a barrier, right? We know where we're at financially. So my humble request to administration and anyone listening is that there is some sort of level of consistency in how we are costing out the motions that are coming forward, because it does feel inequitable at this point. That other piece of the conversation is vital. If we do not have a better sense of the scope and scale of the magnitude of all of this aging community league infrastructure that we are dealing with, and I know we have EFCL that understands it, but they don't have the expertise in asset life cycle management like IAS. They don't understand how to know when to dispose of an asset, how to even start those conversations with community leagues, and they need some help. And so I am worried that we're going to end up in a situation, we're going to have a lot of leagues just turning back those assets over to the city, and we're going to have a lot of liabilities on our hands. And so while I only put this one on the floor, I do want to highlight that there is an ongoing conversation secondary to this that still absolutely needs to happen. So with that, thank you very much. I would appreciate the support from my council committee colleagues. Please vote.
Yes.
Thank you, Mayor Sohi. We have all the votes.
Please display the votes. And that is carried. And there are no notices of motion or motions without customary notice. We are adjourned. Thank you very much, everyone, at 2:30 exactly.